So without further ado, I'm going to introduce Asha. Asha is actually a physical therapist, and her specialty is neuro and everything like that. And she is our speaker for today. She's the CEO of Therex Portal, and she's just a good person, a good friend of mine. And I don't know her. I haven't seen her physically, but I feel like we're friends forever, right, Asha? So again,
Right,
I'll
Mike.
pass
Yeah.
the microphone to you, and you take away, sister.
Thank you. Thank you, brother. So, hello, everybody. Thank you for the introduction, Mike. And I am Asha, and I'm a physical therapist by profession and a neurological clinical specialist by expertise. So, in today's webinar, we will, it's a 4-hour long webinar. I would like to keep it interactive so we can exchange information. And then if you have any questions, you can interrupt me at any point of time. So we'll try to keep it as engaging as possible. And in that way, if you have any roadblocks or any personal obstacles in setting up your own practice, we can always talk about it and problem solve it together. So today's objectives, I'm going to discuss about telehealth and the requirements to fit in a telehealth practice, how to set up a cash-based practice, and how to add telehealth service with documentation, HIPAA compliance, and what are the software solutions out there, and how you could market yourself to the community out there and to grow your practice using telehealth. I will also give you a case study example of how to evaluate a patient, how to treat a patient, and how you do a progress note and discharge summary on a patient. So this will be your agenda for today, and let's dive into it. So this is about me. I have about 15 years of clinical experience, and I'm a board certified neurological clinical specialist. I also treat patients with vestibular diagnosis, and I love treating patients with balance dysfunction, which is my area of expertise. So that's about me. And one of the reason why I developed this application is from a family hardship that we had where my mom could not understand English, and I thought like our instructions need to be in multiple languages. And then I couldn't find a good vestibular therapist for her in the area that she lived in, and then went on to develop the telehealth module to it. So that's about my story there. And for this innovation, we won the National Geographic Channel Award.
Oh
Um,
wow, that's amazing. I mean,
that's
National Geographic chasing. Oh wow,
genius. Yeah, I know. So uh, that's about me. And
I hate you all Indian people. You're so smart.
that's not true. That's
my
not true. So are
my
you, Mike. So are you.
hey, Adrian and Kimberly. It's just and for the rest of the new people coming in, it's just a casual conversation. It's more an interactive, and me and Asha, we're good friends. So I make what do you call this? We make we joke around. So well, anyway, I'm promoting the rest of you guys from the attendee. I'm promoting you guys to panelists, so you guys can unmute yourself, and you can also show your video if you prefer to, and just being interactive here. So again, welcome, welcome, welcome for those people who are coming in. We started a little bit around 9 o'clock, and Asha's already introduced herself and everything like that. So again, welcome for those people who are just coming in. Again, if you don't mind, put in your name, and your discipline, and where are you from? Where are you from? So I'm putting down my name there in the chat box here. My name is Mike. I'm a PT from Martin, Tennessee, and Asha's just introducing herself. So you haven't missed a lot yet. So you haven't missed a lot. So oh, thank you very much, Asha. Sorry. And
Oh,
what
that's
was I?
that.
I said I hated all Indian people because I grew up in the Philippines. If you grew up in the Philippines, comment Philippines in the chat box. But I grew up in the Philippines with Indians, and I ate Indian food with my friends at forgot all the curry in the world. We live in a small, what you call it, small apartment complex, and every other house is actually owned by Indian. So we would smell all this Indian food and all their culture and everything, and they are so smart.
Okay, that's
And
not.
even when we came here in the States, my kids, my kids are smart, but when they compete with other Indian kids, they're so
You,
smart. How do you do
I,
that, guys?
I don't know. I don't think. I don't know. You're just being kind. I wouldn't attribute it to race though. So
Also in spelling. I don't know if you noticed that.
that's because we are ruled by Britishers for a long time.
Is that it?
Yeah, yeah,
Well, I knew, but English is just ask anybody.
yeah.
All right, okay, I'll stop talking. I'll let you take over again, Asha.
That's cool. So that's about me. And now let's go into telehealth. What comprises telehealth? So when you talk about telerehabilitation, it's the use of electronic communication and information technologies to provide rehabilitation at a distance. So if you are not able to see the patient one-on-one in person at your clinic, and if you're trying to treat the same patient through remotely through any digital interface, audio visual means, that's telerehabilitation for you. And there are a few definitions out there that telehealth practice puts out. And I think it's important for us to know what they are. So, because you'll be coming across this language across all these policies and procedures and, the updates that you get from your state and the APTA or ASHA, as a matter of fact. So there are basically three kinds of communications. One is synchronous and the other is asynchronous. Just like you could predict, asynchronous is real time, one-on-one interaction between you and your patient that happens in real time back and forth. And asynchronous communication is the clinician can communicate and the patient can retrieve that information later. So let's say you saw the patient, right, or the patient, and you gave them a home exercise program, okay? The patient can retrieve that information through the electronic means at a later point of time. That's asynchronous communication for you. And then there is one more term that's called store and forward. So if you think about it, like if you break it down just by the words store, you're storing the information and you're communicating forward, like in the future. So it's the process of collecting medical information and sending it electronically to another practice for an evaluation. Let's say if one of us are a wound care therapist, okay? So we can take the picture of the patient or the nurse can take the picture of the wound, and then she can send it through a secure server to the doctor or to the wound care therapist to evaluate, to give her information as to what needs to be done. So that's store and forward communication. And the Center for Connected Health says that patient portals allowing communication between the patient and the provider also qualify under store and forward communication, because the patient can send you a message, you will read the message, and then you will communicate back to the patient at a different point of time. So that's store and forward information communication for you. So when you look at insurance policies, they would say, we allow synchronous communication. Synchronous communication qualifies for telehealth, or we now allow store and forward. Then you would know what it means. So that's the reason why I explained about this. And if you have any questions about it, you can feel free to ask me. So is this clear so far?
Yep.
Looks like it. So good. So now we'll discuss about, is there a need for telehealth practice? Of course there is. With the new COVID outbreak law, we know that it's required. However, explaining my personal story, I started this like 4 or 5 years ago, and then we have been building on top of it. And when we first started, it was difficult for us to um, convince people that telehealth practice is a good means of treating patients, and it would be a good, it would improve the delivery of care and improve the accessibility, reduce the barriers to receive care. But now, with the new COVID outbreak and everything, we now know the pain, and now it's easy for people to understand. But there are also, apart from the COVID outbreak, there are also other reasons where telehealth could make a huge impact. One is accessibility. If you think of a patient who is disabled, like a Parkinson's patient, or a stroke patient in wheelchair, or a person with spinal cord injury, or any patient who is disabled, they need to have a wheelchair accessible van, and they need to have a caregiver, and the clinic that they need to go should be ADA compliant. And if they are trying to maneuver in a power wheelchair wherever they go, the environment needs to be ADA compliant. And not every time the clinics are accessible to the patients, like in their close geographical area. So there is that accessibility barrier that you can break. And then let's say, I think Adrian might be a physical, like a sports therapist or an orthopedic therapist, I'm just guessing. So if you see a low back pain patient, like a software engineer who has low back pain, or a software engineer who has neck pain or shoulder pain, and they have a busy schedule from morning to evening, and if they try to, and if they want to come to you, if they really need to come to you, it takes 3 hours of their time to come and see you, because they have to, get themselves ready, take the permission, drive to your clinic, get the 1 hour of treatment, and then drive back to their office. So that's 3 hours of productive time that they are losing. And if the patient needs to come to you twice a week or thrice a week, then it's 3 half days, if you look at the manager's perspective on the employee. And it's called absenteeism. It's not where the employee is trying to take care of himself, but that's the amount of time that it requires. And not all the time the employers are understanding towards the employees. So if you have a busy schedule, it's very difficult to keep up with the appointments, especially if the clinic is a little bit too far. That adds to the long commute and adds one more barrier to access the therapy services. And weather conditions. I live in Pennsylvania. Katie lives in Maryland. So we know that when it snows, everything shuts down. And when people who already have back pain have to shovel through that snow, then clear their pathway and then get to you, that's another barrier for them to receive care. And you would see more cancellations during these inclement weather times. And financial resources. I will explain that in a moment. So also, when we look at accessibility, it's that within Pennsylvania, we have Lancaster County, where there are, huge fields and everything, and not highly skilled physical therapists are available there. So if a person has a concussion or a vestibular migraine, and he's trying to get to a vestibular therapist, you may have physical therapists around, but you may not have the specific niche that you are looking for. So patients living in rural regions, if they need to get the same quality of care, they are deprived of it. And telerehabilitation or telehealth is an efficient way to fill the gap without compromising the quality or delivery of skilled services. So when we elaborating a little bit about time constraint, this is what I have explained before. So seeking 1 hour of therapy actually takes 3 hours away from your productive time. And having the telehealth service at your home improves efficiency. And I also have noticed that patients are more accountable towards their progress, and they do their home exercises very religiously. This is kind of an irony, but that's true. when the patient comes to you, they depend on you, and then they don't do their homework at home. They don't do their exercises, and then their recovery is protracted. But when they know that you are teaching them the exercises that they're doing at home, they take more ownership of it, and they are more adherent to the exercises, which you would see in your results. And the weather, as I said, patients have a risk of injuring themselves when they are trying to push towards this inclement weather. And when you consider a larger hospital and the number of cancellations that the patients have during this inclement weather, it's a huge loss of revenue. If some of you have private clinics that you own, that also is a huge loss of revenue. And likewise, during this COVID outbreak, because of the cancellations, we had to shut down the outpatient clinics, and I do understand the pain that everybody is going through during this time. So I said I would explain you a little bit more about financial resources. I think, Katie, you may find this interesting. This is actually a study done by Speech Therapy Services on a typical neuro patient who has Parkinson's. And what they're trying to say is, to bring the Parkinson's patient to the clinic, it requires two people. One is the patient and the other is the caregiver. And the speech therapist tried to, what they did was they treated this patient at home through LSVT big and loud approach. So it saved the speech therapist 48 hours of time, or the patient, 48 hours of time. And then which equates to more than 92 hours of work time. And it translated to $1,024 of caregiver costs. Not the transportation, it's the amount of money that they had to pay the caregiver. And the patient was seen 4 times a week for 4 weeks, which makes me think it's a loud LSVT loud program. So this is a study that was done and published, and it was published like maybe 3-4 years ago. It's not recent, but you can see like not just coming to the therapy, there are additional costs that you may not think about that the patient has to go through when they're trying to come to your clinic. And if you are providing cash-based practice to these patients, they see the value in it. They see that they could reduce their, it decreases their financial burden. And also the caregiver availability is a huge problem to most of these patients who are lower functioning. So to go into telehealth practice, what are our requirements? So just for the sake of remembrance and easy memory, we are going to categorize the requirements into 3 basic items. One is professional, the second one is legal, the third one is technology. So professional is APTA, ASHA, or if you are an occupational therapist, AOTA. So always the state law supersedes. So right now we have COVID, right? Originally, Pennsylvania did not approve telehealth. So it was not under compact law. It did not, telehealth, it has proposed the bill wasn't signed off, it's not enacted. But then because of the COVID and the governor ruling, telehealth is accepted right now. So it's always that the state law supersedes any other rule and policy. So you always want to pay close attention to your state's telehealth law. So if you think about it, we are going to look at a checklist. So this checklist will help you problem solve how to explore or how to understand the practice guidelines. So the first question you have to ask yourself is, does my state support telehealth practice? Do I need a direct access license? And even with this direct access license, it varies by state. So in Pennsylvania, if you are a direct access provider, If you treat your patients, that's good for 30 days. If you treat your patient and if you discharge them within 30 days, you do not need a signed script. However, if your patient needs extended care, you need to have your evaluation signed by a physician. So that's direct access license in Pennsylvania. In Texas, it would be a new policy. In Maryland, it would be something else. So you always have to know what the state practice telehealth law says and also what the direct access law says. Does my state have a parity law with telehealth practice? Again, these things change. Pennsylvania did not have a parity law before, but now it does. So what parity law means is that if your patient is given live one-on-one attention in your clinic, whatever charges that the insurance pays through a live session, even when you provide telehealth services, you will be paid the same amount of revenue, amount of money or charges for your telehealth visit. So when you are treating patients private pay or cash-based practice, if you know what the Medicare currently bills for the patient, if you are seeing an elderly patient, you can charge them the same amount of money for a telehealth visit through private pay. So when you are trying to understand, many people have this question: what should I bill? How should I qualify my services? How do I come up with a cost plan? So this would be a simple clear-cut understanding, and it's also easy to make your patient understand as well the parity law, and also knowing what the insurance pays for these patients. So you also want to again inquire if there are any specific requirements in my state to practice telehealth. So these are the questions that you have to ask yourself. These are the questions you do your homework before you establish your telehealth practice. So this is a compact license state, So the color in, what is it called, blue or, dark blue, are the states that have accepted compact privileges. And the one in light blue are enacted, the legislation is enacted, but they're not yet issuing active compact licenses. And the ones in green are where the compact legislation is introduced, but it has not passed. So if you look at Pennsylvania, the compact legislation was introduced, but it has not passed. But because of the COVID crisis, we currently are able to see patients through telehealth services. And the ones in this gray area have not taken the step towards implementing telehealth or putting the bill in. So why is this important to us? I will explain shortly. You also want to, when you're looking into compact license, you also want to know if your state is part of the compact license. And you also want to ask yourself the question, do I want to practice in another state? And if so, what are the telehealth regulations in that state of practice? So let's say I'm currently, right now, I'm not part of compact state. So I will take a state that is part of compact. Let's say I'm licensed in Texas. I need to be currently residing in Texas to practice telehealth. So my physical location or my permanent address should be in the state of Texas. And that qualifies me to apply for a compact license. And once I apply for the compact license, then I am eligible to apply for a compact license in any of the participating states. So if I'm in Texas and I want to see a patient in Arizona, I can do that. If I'm in Texas and if I want to see a patient in Utah or North Dakota, I could do that. But before I do that, I need to know what the telehealth policy or the state practice guidelines are in North Dakota. Are they in line with my own telehealth practice guidelines? What is the direct access provision in North Dakota? What do they need in North Dakota? Or are there any specific requirements or Or if you are treating through insurance, do all insurances accept it? Or are there any restrictions with regards to insurance? Or what kind of communications do they accept as telehealth practice? You also want to do all that research beforehand if you narrow down or pinpoint on another state that you want to practice in. And before you even apply to that second state, you have to take the jurisprudence exam and pass it, and then you would be eligible to apply for a second state to get your compact license. So I think this is just a repeat of what I have said. So Adrian asked, Medicare doesn't cover telehealth yet. So would you be doing cash-based and charge your own price? Yes, you could do that. So what I was telling earlier, Adrian, is that if you are doing cash-based, some people always struggle with how to come up with a pricing point. You could keep it at the same price as Medicare bills, or you can come up with your own pricing point. There is also one more legality aspect that you want to check off when you're treating patients with Medicare, which is advance beneficiary notice, which I will discuss shortly. Basically, what it says is Medicare has never accepted physical therapists under telehealth practice guidelines. So, if Medicare is not paying for a service that that we certainly know of, we can give the patient a document that says we are going to evaluate you and treat you, but we know that this service has not been paid in the past through Medicare. So if we will still bill Medicare, but there is a good likelihood that the claim will be rejected, and if the claim is rejected, it's your responsibility to pay for the services provided. So that's an advance beneficiary notice. And if you give it to your patients, then you're covered. Did that answer your question? How would the pay be for a physical therapy assistant? So if you are a physical therapy assistant, Mike, do you know the answer to this? Like in home health agencies, do the PTAs, do you know what the charges are for the PTAs?
There's no structured payment yet for telehealth for PTAs. In my case, to tell the truth, I provide wellness services, and I just make sure it's a wellness service, and then I charge cash for it. And that's the reason why we're here. We want to just provide a wellness, quote unquote wellness service, because the telehealth insurance system is still evolving. I saw a webinar from Rick and Rob, and it's still evolving. I mean, with this current situation we have right now, it's so hard to determine if they're going to pay or not. I heard from the grapevine that they've already approved for Part B, Medicare Part B. And obviously there's an issue with it's either telehealth or e-visit or whatever. I don't know yet. I don't want to without information there. It's just because it's just evolving. But what I do know, Medicaid pays for it now.
Yes,
but there is a limit to the units. You can only use 2 units, I believe. So when you're providing Medicaid, if you're providing services through Medicaid, that's good. You can use this telehealth. The agency I'm contracting with right now here in Memphis, they are providing telehealth services, and they're using Zoom. They're using this software here, and I've been wanting to partner up and use Therex Portal for them. But like what I said, but there's no actual structure yet. Even Medicaid services, they don't know what they're doing, so they're just letting all the providers, okay, go ahead and use it. Just make sure it's a maximum of 30 minutes. That's it. So,
okay. So answering your question, Patel, if you are a physical therapy assistant, so just like your state practice guidelines say, you always need a physical therapist to establish the plan of care for you. So assuming you're working in a clinic which is cash-based practice, and the physical therapist initiates the eval, and then he gives the patient to you to follow up, then I think it basically depends on your organization structure and what they would want to bill for the patient. Some clinics have been doing what is it called? They collect a fee, a structured fee for like 10 visits or 20 visits. I'm blanking on the name. It's in my head, but I can't say it out. Like a plan, like a program. Like they
Bundled payment.
bundle payment. Yes, thank you, thank you so much. So they pay for like 15 or 20 visits, and then all the visits that are provided in it, be it physical therapist or physical therapist assistant, they get inside the bundle payment, and the patient pays for it. So there are no really hard and fast rules as to how much you should charge your patients. It actually depends on your own discretion.
Yeah. And that's the beauty of it now. There's another question from Mike. Mike here. He asked, what if I'm not a Medicare provider, but in private practice? Right now, I'm a Medicare provider, but all of my telehealth patient are actually cash paying patient. I recruit them through my other group called Alzheimer's and Dementia Support Group. It's a big group, it's like 30,000 members there, and basically there are, I don't know if you guys know it, I'm quote unquote the dementia guy, so that's my private group there. So what I do is basically market myself in that group and tell them, hey, I'm the dementia expert. If you need not physical therapy, if you need exercise program, I can do that. So it's all cash based. They pay me through my website, $150 per session, and then that's it. My ultimate goal is to provide a group exercise session for them there on a low price point. So right now we have a membership site. We have like I think 107 people in that membership site, and we only charge $4.99 a month. So $4.
Oh, really?
Let me show it to you guys real quick. So I'm still searching.
I think we can't see your screen yet, Mike.
Oh, not yet. Okay, hold on. Let's answer some of the question first.
Sure.
While it's still loading.
Yeah. What if?
Can I bill cash for Medicare provider? Medicare. Okay, that's a very tricky question there, Mike, because when the patient has a Medicare, you need to use their Medicare, right? If it's skilled. Now, the only way to work around that is to provide a wellness service. Wellness service. That's the key there. That's the word there. Are you providing a skilled therapy or a wellness service? In my case, after I've seen the patient for a while, for example, regardless if it's telehealth or one-on-one, once we're done after reaching her, cap, although there's no cap anymore, right? But I don't want to go more than the cap. Well, I go more than the cap every now and then. But let's just say they went over the cap and I can't find anything skilled anymore. I transition them to wellness. I have several patients right now that I see, and it's wellness. We just do exercise and everything like that. No, yes, there's still a skilled component, but it's more like a wellness or quote unquote maintenance. So they just pay me cash. So if I can do that, regular exercising, you can bill cash. Now, if it's really a skilled therapy, for example, it's an acute situation or a recent stroke and everything, you have to bill Medicare by law. Now, it's different, okay, because we're doing a webinar, but that's the law. That's the law there, okay?
So Mike, the other guy is also a Mike, right? So
yeah.
Okay. So Mike, if I'm understanding your question correctly, so you're asking me by meaning Medicare provider or Medicare beneficiaries. So if the patient has an active Medicare insurance and he comes to you for therapy services, are you asking if you can bill him through cash? Is that correct? Is that what he's asking? Is that yes? Okay. So currently, at the moment, I think you could, because if the patient is not an active patient. So I took a course by a lawyer recently, by an attorney. And what she said was, if the patient is an active patient of yours, like if you're currently seeing them and then you had to stop the treatment because of COVID, then you have to continue with e-visits. But if this is a patient you haven't seen in the past 2-3 months, he was discharged and he's starting up new, then I think you could go out with the ABN, Advanced Beneficiary Notice, and bill them cash base for your telehealth eval and follow-up visit. Did I answer your question? Was that clear?
Oh.
How about if you're, yeah, okay. If I'm not participating in Medicare, but a patient has Medicare, if you're not a Medicare provider. Okay. Then I'm not sure if you could see him. Can you see him if you're not a Medicare provider?
Well, with all the webinars that I'm watching and listening, you will have to. But like what I said, the only way for you to provide that, because you're either participating or non-participating provider.
Mm-hmm.
So the only way for you to be able to see that patient, quote unquote, is for you to provide a wellness service. It's to provide a wellness service. So, all right.
Is it possible for speech? What are the words to avoid? So wellness service is something like, think of yourself as an athletic trainer.
There you go.
Or a gym instructor. You're not a physical therapist anymore. You're not a speech therapist anymore. So if you were to have like a college degree and before your physical therapy school, you started on fitness, and then that's your mindset. And if the patient has pain, you can't do any, like you wouldn't be able to problem solve that for the patient. You're just giving them training to get stronger and maintain where they are. But if the patient comes to you with a clinical condition, like while I'm doing this pain, my arm hurts, I feel like my shoulder is pinching, then you put your PT brain on and you think about it. Does he have a rotator cuff injury? If you're thinking about it and modifying what he's doing, then it's no longer a wellness. So if you're addressing the clinical condition or the impairment with your physical therapy brain, then it wouldn't qualify as a wellness. And if you are thinking in like an athletic trainer's hat and you're doing services like an athletic trainer, then it would qualify for a wellness service. And most people have done like nutrition therapy as a wellness service, because it's very clear and demarcated. And if you are a yoga therapist, a yoga instructor without a PT brain, then you could do a certified yoga class and that could qualify as a wellness. Tai Chi could qualify as a wellness. So things that are in the fitness realm that do not require like modification, that could qualify as wellness. And if you already established a balance program, some people in the YMCA do this senior fitness silver sneakers program, right? But then there are no modifications done to the patients. They will have chairs and everything, but they do not modify it for the patient. That's wellness again. So that's your clear demarcation if it qualifies for a physical therapy or a wellness. And speech therapists could also, I believe, contribute to wellness.
Yep. I just would like to follow up with the answer with the question of Mike there. Do we need to still bill Medicare and wait for it and get denied when I give ABN? No, you don't have to bill because you're not a participating provider. You are not participating with Medicare. You only give that when you have a relationship with Medicare. If that makes sense. If you have an actual relationship with Medicare. Now, if you don't have any relationship, why bother? Why bother? So the bottom line, I would just recommend provide a wellness service. In connection with that, with Chantal's question, But if you run a wellness service, can you yes, you can advertise yourself as a physical therapist and a trainer. Definitely. I don't know if you noticed, that's what I do. When I go Facebook Live, hey, hello, my name is Dr. Mike Chua, physical therapist, certified dementia
I took
practitioner.
medicine.
So, do you still hear us, Kimberly? There you go. All right. So, let me, I hear.
Can you hear me?
Yeah, I hear you. Okay.
Okay.
There you go. Let me just, can you stop your screen share so I
Oh,
can
is
share
that
my
me?
screen?
Oh, sorry about that.
There you go. And then I'm gonna share. This is what I do, guys. I have what you call, if you can see my screen, comment C
Yeah,
or whatever.
we can see
Yes.
it. Yeah.
There you go. Okay, so this is my big Facebook group called the Alzheimer's and Dementia Support Group. We have, I think, 31,000 members there. So every day I've been adding people, 3 people wanting to join the group and everything like that. This is a free group, just like our alternative careers group. So here I go live here, I support people and everything like that. And this is my target market, dementia. So what I do is educate the people here, talk about dementia. Now, I funnel them, okay? I funnel them towards our paid group called ALZ Prime Care and Training and Education. So here, this is a free group. And then there's another group. We funnel them here to a paid group. We only charge $4.99 here. We have 106 members there. And I do Facebook Live here. This is what I did last time or last March, basic of hand hygiene and stuff like that. And we provide, informational stuff like that. And my goal is to use Asha's platform, Therex Portal, and then do a Facebook Live here. Obviously, as I do this, I welcome people here. They pay $4.99. Okay. And my goal is to ultimately use Asha's platform and then do a Facebook Live here and provide a group exercise session, for $4.99. Now, if they want one-on-one, because all I'm doing is caregivers, I'm educating and exercising and wellness with caregivers. Okay, nothing skilled, and it's much easier than doing insurance, than billing insurance. You can still do insurance if you want to, if it's approved, after a month or so. But this is the easiest way, and a lot of people are already doing this. A lot of not even therapists, wellness people, personal trainers, they're doing it online now. And if they can do it, we as therapists, we're all what do you call this? We're all qualified to do it. And we just have to take action and go out there and just owning what specific niche you wanna own. So if that makes sense, comment makes sense, because you need to find the group that you want to serve. You need to find the group that you want to serve. So if you want to serve dementia patients, boom, that's the group there. If you want to serve whatever, balance people, create a group for that, because you cannot just be a regular telehealth practitioner, because everybody's wanting to be a telehealth practitioner. Hold on, let me turn that off. Somebody.
So, Chantal, I think you asked one more question.
There you go.
But if you run a wellness service, can you advertise, market yourself as a physical therapist and a trainer? I will tell you what my colleagues are doing with this. What they do is they have a physical therapy building that they lease, okay? And in that, they provide either Pilates or yoga or something that, that would look like wellness, like even it could be like a balance program, balance class. So you would word it such a way that it's we also provide wellness balance classes. So as a physical therapist, you're seeing your patients for a regular evaluation. And let's say you saw a Parkinson's patient for mobility, ambulatory dysfunction, or gait dysfunction. You treated them for 3 months. Okay, so you improved them, and then we know Parkinson's patient don't they need to continue working. So when once after the 3 months, you put them in the maintenance class, and then in the maintenance class they will stay there for like 2 or 3 months, and then sometimes at the end of the year, they come back to the original physical therapy program again when they feel like they had either plateaued, or they had they feel when they feel like they made a slight decline in function, then they come back to physical therapy services. When the patient is in the balance group, you're involving them with like 3 or 4 patients, 3 or 4, not patients in the sense clients. So you're involving them with 4 or 5 clients, and then they're maybe playing a ball or doing kickboxing or doing some obstacle course, which does not require you to be guarding them all the time. So those are things that they could independently do, but they're there in that group for motivation, for like a group activity. And in your primary physical therapy program, you're actually doing outcome measures, you're evaluating them, you're doing a progress note, you're doing all these regular physical therapy services, and you're putting on your thinking hat. Does that make sense? This is how a few of my colleagues have done. They have like clear demarcations as to both in the branding of the name, as well as the physical location. Like one thing looks purely like a wellness, and the other thing looks like a physical therapy place.
Perfect. And that's what if you want to check out actual clinics who are doing that, check out the Patrice Hassan. She does that. Her company name is called Group Hab. So she has a physical therapy clinic, and she has a group exercises. Now they're providing telehealth. Another therapist who's actually doing that and really, making good money is Stephen Dunn. He specializes in Pilates. So he has a clinic and he has a Pilates studio. And then now he's offering telehealth Pilates because of all this stuff going on. And if they can do it, guys, you guys can do it too. All you need to do is take action. I need to take action. So I need to do that program, because I think it was Friday. I joined a group exercise session with Dustin Howard and Jason Wright. You guys got to join that. It's an online. It's Zoom like this, and they're exercising live like what we're doing right now, and I'm following them. And it's nothing fancy. We did push-ups, burpees, jumping jacks, squats. That's it for 30 minutes. And I don't know if you see my you want to remove your screen for a minute? My whiteboard there.
Yeah.
I'm actually formulating 30, 30, 30. It says 30, 30, 30. 30 exercises for 30 reps for 30 minutes. And that's what I'm going to offer in my group, in the Alzheimer's and Dementia Support Group. First, it's going to be free for a month. We're going to do it, probably Monday, Wednesday, like what Jason Wright and Dustin is doing. See over there? I have a list there, 30, 30, 30, 30 exercises for 30 minutes for 30 reps. And I'm going to offer that for my group, the Alzheimer's and Dementia Support Group, for free for a full month, obviously right now because of the COVID thing. And then after a month, if they want to continue, I'm going to charge them. Obviously, it's going to be free for my $4.99. It's included in the $4.99 membership. And if they want to keep on joining from the big group, they come and join that paid group. Did that make sense? So it doesn't have to be a traditional one-on-one therapy. You can do group. You can do you can do what we're doing. And like what Asha said, you just have to find find that niche that you can serve. Chantel said here, the last clinic our work used to offer services like that. See, they can do it, guys, we can do it too. We're all therapists here, and we might as well own that niche and market.
Mm-hmm.
All right. Sorry for talking too much, Asha.
No. That's good. That's good. That's all good. Chantal, I want to ask you a question. May I know your area of expertise? So in that way, like we can make this question, like we can come up with a real example. So postpartum women. Oh, perfect. Okay. So if you are treating your women's health.
That's really good.
So if you are a women's health specialist, right? So you're treating women postpartum who may have diastasis recti or who may have like a prolapse or something, So you're treating the actual condition, medical condition, you get them better, and then or like incontinence. So they are no longer leaking, and then they are at a good stage. But when the person is discharged from this postpartum session, you're putting them in a maintenance class where you could give them, just like what Mike said, like a digital exercise program where they could maintain those exercises for like 2 or 3 months. And sometimes people fall off the radar when they're not supervised. So if they take more coffee or something, or they have more stress, they again leak. So then then they are able to, even in the maintenance class, you can chat with the patient back and forth and see if they are adhering to the exercise program, and you track their adherence, and that's all under maintenance. But those exercises you're not modifying. You're giving them a set of exercises. You're not putting on your thinking hat to see if they have progressed to the next one. Or you can actually divide those exercises into 2 or 3 phases. So in the first 3 months, you will do this, or if in the next 1 month, you will do this. But you're not changing it because the patient has said, now I am, this is causing pain or something. When the patient says pain, then you have to bring them back to physical therapy. When the patient says I am leaking more now, then you have to bring them back, because that's where you are evaluating the patient again, making sure their strength is sufficient, or if they have some spasm or something. Does that make sense now? Perfect. Yeah, that's good. That's good. So I think every time when we relate it, we understand it better. That's my thought process. So
Asha, I guess this is in relation to me, right? I mean, for those people who are in our live webinar, obviously ask questions. This is the perfect time because we don't get this all the time. I guess my next question for you, Asha, for me, I need those consent form and everything. Does Therex provide that for me, or do I need to create
we already have the consent form inbuilt into the platform. So when you send your patient a schedule invite, the patient automatically gets the consent form.
Cool. Yeah. How about like what my plan is? I want to do a group session. How does that work? Can I just
so for a group session, do you need a consent form?
Yeah, so that way I don't get sued. It's like, oh, he's a physical therapist. He told me to turn my head 360 degrees. So you know how they are. Right.
We currently don't. We have not included. We primarily are treating physical therapy. We did not include group yet, but that's on our what is it called, pathway.
Okay.
Yeah, we'll work on it in future, like Zoom calls, where you talk with 5 or 6 people.
Yeah.
And then it no longer becomes I wondered though, Mike, if you need a written consent at that point of time. Do you need
that? Yeah, that's what I was thinking. Because I do have a consent form for my one-on-one consultation like this. They just click it on my website and that's it.
Right. Yeah.
But nothing for the group. But because I haven't started it yet, I just realized I can do that too yesterday, because I'm like, if Jason and Dustin are doing this for a physical therapist, I think I can do this on my caregiver group.
Yes, of course. Yes. And at that point, I don't think you may need a HIPAA compliance or anything for that matter of fact.
Yeah.
You know what I mean? So you can just email them the consent form and they can sign it and send it back to you.
Like a Google sheet or something
like that. Like a Google sheet or something. You don't need a You don't need a secure HIPAA platform
Mm-hmm.
to have it encrypted and do all those things, because it's a group class.
Mm-hmm.
It's like them going to a YMCA.
Okay, cool. All right.
Yeah.
Thank you.
Yeah, you're welcome. So we are here, right? So you can see my screen. Yeah. So with compact license, right? So we must make sure that the home state, the state that you reside in, must be a member of the PT compact and is actively issuing compact privileges. When we go back to the ones in, let's go back here, right? This is sometimes confusing to me. So this one in dark blue is the one that is actively issuing and accepting, and then there is this light blue which has enacted but it's not actively issuing. So you have to be one of these dark blue states, not the light blue ones. So if you are in any of these state and you're physically residing in that state, then you can go ahead and apply for the compact in the neighboring state or whichever state you have more contacts with. Okay. And you must have no active encumbrances on any of your licenses. I actually do not know what this word means. I meant to Google it up and I did not. Do you know what that word means? Encumbrances. I think it's some kind of a legal term.
Well, if you, it's basically, it says here, a burden or impediment. So if somebody actually, some issues with your license, I guess. Yeah.
Okay. So I don't know actually how to define that. But I do understand what a disciplinary action is. So I didn't know how to
Yes.
differentiate
Yeah.
between these
Something
two.
like that.
Something like that, yeah.
Mm.
And you must have no disciplinary action against your licenses for a period of 2 years. When they say licenses, like if you are a compact provider and you're licensed in 4 states, you should not have any disciplinary action against you in all those 4 states for a period of 2 years. So
does a lapse in CEU count?
That's not a disciplinary action, is it?
I got fined. I have 2 licenses in 2 states, actually 3. And
I think it's that this may be something like a malpractice license or something like that. Like
they fined me for $400 because I didn't renew. This is what's funny. I have so much CEU classes. If you have so much CEU classes, comment CEU there. And you know what I forgot is totally forgot to renew that jurisprudence for Kentucky. I took it through MedBridge. I teach a class on CEU. I have like 200 hours of CEU. And apparently the state of Kentucky wants you to take the jurisprudence through their website.
Oh, okay.
So they can, obviously make money from it too, which is, understandable. So I took it through MedBridge, which I have the certificate, but you have to. So if you're practicing in Kentucky, comment Kentucky there, because you need to take your jurisprudence and all the other ethics stuff through their website, so they can, get the, make money out of it too. So yeah, and that's what I forgot. I totally didn't.
So when you're doing so many things, Mike, you're bound to forget. I think it always gets me. Like,
and I don't see patients in Kentucky. I probably, the only reason why I got one because I'm in the border here in Kentucky, and I saw some patients there, probably 1 or 2, and I just decided to just renew my license, and they said, we can't renew your license because you don't have this jurisprudence. I said, I got it. But they said, no, you have to use our website. So I got fined there.
Oh my God. So you have to be like a good accountant, like cross all the boxes and all that. It's so silly, like how the system works.
All right. I'm sorry. I keep on talking.
No, that's okay. So this will take us on a tangent, but let's not go there. So so these are your requirements to get a PT compact license. and you visit that site, ptcompact.org. So when you are practicing telehealth, right? So this is like the chain of command that we follow through. The Center of Connected Health is the primary agency that frames the telehealth policies, telehealth laws. And then the APTA, American Physical Therapy Association, Occupational Therapy Association, Speech Language Hearing Association, they accept those policies from the Center of Connected Health, and they make them adaptable to their specific discipline. And within the physical therapy, we could always go back to, there are two really important resources that you could go through, which have a lot of information. One is Private Practice SIG, it's Private Practice Special Interest Group, and then there is a telehealth section special interest group as well. It's called Technology something. So in these two resources, in these two special interest groups, you will find lots of information about telehealth practice and what you could do. And as I said, the state law always supersedes any of this. So it gives you information on the telehealth and the state practice guidelines. And if your state is part of compact license, or if there are any exceptions to practice telehealth with COVID-19. So I think yesterday night, APTA released one more document as to which states have waived off the, took a step forward towards telehealth. And there are many states that did, and I will share that resource with you at the end of this class. So that goes back to, I think it's Mike who has asked this question before. What is a Medicare e-visit? Or if you are a Medicare provider or beneficiary, can you bill your patients? So what Medicare, the CMS says right now is that if you are treating a patient currently who is on Medicare before the COVID outbreak, and then they had to stop because of the COVID, you still have to continue seeing them through an e-visit. And e-visit runs for a period of 7 days. And within the 7 days, you can bill them for like 15 to 21 minutes. And you are not seeing the patient, you're not like having a audio visual communication. If you want, you could do that. But all you're doing is you're sending them some exercises or some information, and the patient has the link to access that information at any different point of time from his home over a 24-hour period. Like he has 24-hour access to this, round the clock access to this information that you provide. So earlier when this e-visit came up, APTA said you shouldn't be marketing any visit. But then it changed the rules, and then you could, on your website, you could say you could give them information as to what an e-visit is, what you would do for the patient to provide an e-visit, and what kind of software you're using, and how would this be done, and what would be the minutes that you would be charging the patient. And this doesn't have any of the cap limitations to issue your patient this service, like to get your patient this service. So
Asha, I have a question there.
Mm-hmm.
Well, I'm sure you're gonna talk about it too.
Please go ahead.
Obviously, you can't solicit to schedule an e-visit. I guess my question is the pay the same?
No, the pay is very less.
Yeah.
The pay is like $31 or $27, something like that.
Mm-hmm. Okay.
That is over the course of 7 days.
Mm-hmm.
Not. So it's for the whole week. And if you think of it, how much clinical decision making goes into like 21 minutes over a course of 7 days?
Mm-hmm.
Very minimal, right? So it's as if you're washing away the tears. I don't know, like how this qualifies and what kind of clinical decision making is involved in it. So it's, to me, if I were to look as a skilled therapist, it's useless to me. So it's just that the patient cannot come, so you're giving them an exercise program and then saying bye. That's all. So, and
saying hi, hello,
and bye. That's it. So if the patient has any change in health condition, or if they're having more problem, so let's say you're seeing a patient for shoulder pain, you wouldn't be giving the same exercise program for like 2 months, right? So it doesn't meet their needs. So however, even for this small amount, you have so many policies. You need to use the disaster recovery modifier, CR modifier, and then these are the 3 codes that you would use. The first one is 5 to 10, the second one is 11 to 20, and then 21 or more minutes.
Mm-hmm.
So and then I listened to the APTA meeting. So how do you actually demarcate this? So, like in our billing, we do 7-minute intervals. So if you're treating the patient for 7 minutes, bill them under 2061, 14 minutes, 2062, like 21 minutes, 2063, like that, like, every 7-minute intervals or 8-minute intervals, you can use that G codes.
Mm-hmm.
And if you're a mobile practice, you'd be using the place of service code as 12.
That's what I've been using, that one there. Mm-hmm. But I haven't done the e-visits. Well, because they mainly refused me. Either they refused me or I still see them. And I haven't attempted to do the e-visits.
It's not very useful for the patient from my perspective. And it also, as a clinician, I do not like that, because if you are giving them the exercises and something happens to them or they do too much of that, then you have no way to go back and say, please reduce it or do something else. You know what I mean? So I don't think you are setting them up towards success in this path.
In majority of I don't know about our attendees, majority of my Medicare Part B patient, they don't even have a smartphone. So, but according to the webinar, it doesn't have to be a smartphone. It could be just a phone call. Am I correct?
It can be a phone call.
Okay, all right.
It can be a phone call, and if the hospital is already using a patient portal, you're required to use the patient portal.
Oh, okay. Well, I'm just the one-man team.
So you could use whatever you are using. So it doesn't have, as long as it's HIPAA compliant. But they also waive the HIPAA policies. So as long as the patient has 24-hour access, round-the-clock access to that particular information that you gave them, then it qualifies for a patient portal.
Okay.
They have to be able to securely sign in and have round-the-clock access to that information.
Well, how about me? I'm just,
So you can use
them.
You can call them. You can make
use my regular phone.
Yes.
I guess that's what I've been doing, right?
Yeah.
Okay.
Yes. So that's an e-visit, and it's as you can see, it's very limited. So I think the reason why it came up is when you see a doctor, a physician, all they have to do is prescribe medicines, right? So when you have to refill your order, your medication, then the doctor sees you and then quickly gives you your medications, and then you're good to go. So that's where this came in, and then they pushed it towards physical therapy. I think that's how it, but then when it comes to physical therapists and occupational therapists and speech therapists, it doesn't hold value. That's the disconnect there. So it's only for existing patients and allows you to bill to a maximum of 20 minutes, and you have limited time to treat. And you were asking me a question about soliciting, right? They say if you can, how else is the patient supposed to know about e-visit? So not many patients are knowledgeable, or and government doesn't do a good job in educating them. So how would they know? So you can give them the information on your website, and if they ask you the question, what is an e-visit, you can explain them. All you have to be careful of is to say, are you interested in an e-visit? You shouldn't say that, but you can say, this is what we do, this is what we are doing now. And if the patient say, I want to do it, then you can go ahead and continue with it. So earlier, Mike, I was explaining you about the advanced beneficiary notice. So right now, telehealth is never a part of Medicare payment charges. So it's not a service that Medicare paid for until now, or even before. Like, since it's not a service that Medicare pays, if you are a Medicare provider, if you are in that category, you can give your patient an ABN and say this may be a service that the Medicare will deny. And so if they deny, then the charge, you are responsible for paying the charges. In that way, you don't incur all that loss of time. So that's advanced beneficiary notice, and you can include that in your patient consent form, or you can give it as a separate document for the patient to read and understand. So coming to the billing requirements for telehealth. So eligible providers report a modifier which is GT or 95. And the place of service code is 02, which is live one-on-one session. The synchronous information that we talked about, that's 02. And the revenue codes are those, and those are the procedure codes. And in the procedure codes, I included physical therapy, occupational therapy, and speech therapy. So not all of them are physical therapy. So we included all the 3 disciplines. And that's the link from where this information is gathered. So what I want to do is, let's pick one state, and then we'll check the practice guidelines in the state. We'll look at the direct practice, direct provider rules, if you're a direct provider, and we'll look at if it is currently part of the COVID disaster recovery program. So you will know that what you could do if you're taking up this private practice tomorrow. Shall we do this? In that way, we can
Definitely, yeah.
navigate through the system and understand it.
Who wants to volunteer their state? Adrian said Illinois, so there you go.
Okay, so
Kimberly said Maryland, so let's do Adrian first.
Okay.
How many states are we going to do, Asha?
We'll do 2. That's good. Yeah.
Okay.
So Kimberly is speech therapist. Kimberly is speech therapist, right?
Oh, yeah.
Adrian,
are you a PT?
Adrian is PT.
Okay. I need to learn that too because I go to Illinois.
Yeah. So what we are doing, what I do for my state is I go to this ppta.org site. So this gives me the Pennsylvania Physical Therapy Association. So what we will do for Adrian is, he's Illinois, right? Illinois Physical Therapy Association. Okay. There we go. So so it says right here, Corona information for members. So we'll click that. So this is another information that I wanted to give to you. So right now the states are waiving off the continuing education information, or also if you are pending license renewal, or they're relaxing certain policies. So if your license is about to renew, then some of them are waiving the requirements that are required. And what we want to do, learn, is to know if this state is part of a telehealth service, right? So here you have this information: governor signs executive order for telehealth services. So you're good to go. As I said, like if the governor signs something, the state supersedes. And if Illinois is not part of compact earlier, even if it is not part of compact, you can now treat patients through telehealth services. And here it says the Medicare and Medicaid services information, Aetna, Blue Cross Blue Shield. So they gave you all this information as to what insurance accepts telehealth services. So right now, I think I'm in this COVID-19 relief thing where it says like telehealth services are expanded. Since the state board has published this, which it means you can practice your telehealth license. Now, what we will do is we'll look at direct access license laws and regulations.
Well, do you have direct access in Illinois, Adrian?
Why is there not a search button? That's crazy.
Member search. Adrian said yes, it is limited. When you say limited, what does that mean? You need to have a physician signature too after 30 days? That's the same here in Tennessee. We have that. Oh, 5 days? Oh, wow.
5 days? Oh my God. Okay. Okay.
I don't even
Anyhow,
have 30 days. I can't even get a signature in 30 days from my physician.
So here, Adrian, if you looked at it, we know that telehealth is covered. So you already researched about your direct access license, and I can't find this information here. But you can see here, like dry needling, they have information on dry needling and all those things. So in the practice guidelines, if you see that they gave clear information on telehealth practice and what codes you need to bill, you are welcome to do that. But if you are billing through private pay or through cash-based practice, all you have to do is to give them a super bill. So the information that you need from this state board is that, is this state part of the COVID disaster recovery, which is the answer is yes. And now you can practice telehealth. And since it's a method of service to your delivery of service to your patients, all the practice rules that you have as a direct one-on-one provider apply to the telehealth practice as well. And if you want to see the patients before the doctor sends them to you, you need to know your direct access limitations. And then when you are teamed up with a physician or you know the patient's physician, give it to them and then get that signed and you are good to go. So that's for Illinois. And I want to show you, I am actually pleased with our state board. It keeps it very clear. So this is COVID-19 resources, right? So if you click on that, you know, it goes by, you know, wellness and self-care. What can you, and also what are the telehealth clarifications? What are the payer updates? And it does a good job in explaining everything. And what insurances are covered: UHC, Aetna, Independent Blue Cross, Horizon Blue Shield, Highmark, and then the insurances that are paying only for e-visits and not audio-visual aids, and then the payers that are not paying for telehealth yet. So it gives you a clean list of it. So APTA also put down this list, and I have included this in our resource list. So this is something that I liked. So it what it did was, like in the disaster management page, it included all the states that are exempt from the original telehealth mandate, and then you can view the role of the PT and PTA, and also figure out if your state is part of that disaster program, and you can access that information as well. So here is the form that I am pulling over here. And I will, and this is what I was explaining to you about the waiving the license requirements and renewals. So if you were to look at Illinois, not in this, so they did not declare anything. So we'll quickly look at Maryland since we are here. So he announced that he's activating the state's reserve medical and allowing providers out of state or expired licenses to practice in Maryland. So Maryland has more liberty than Illinois in this context. So if your Maryland license is about to expire, or if you want to get to Maryland, then you can, it's easy right now. So you can quickly look at this policy. And also, this is the emergency practice orders, which is, and if it is yes here, then you can practice in that state. So let's say Illinois, it's yes. We spent all that time, but we could quickly look at this. And then Maryland.
What's that website again?
So this is APTA's resource list. I will share it. I put all these resources in one folder and I will update it in your drive.
Mm-hmm.
So
can you copy the link up there and then paste it here on our chat box? I'm gonna check on it real quick.
Sure. Can I add the document here?
Yeah, just copy the link. Well, is it? Well, I guess it's your. Is it in your file?
Yeah, I think so.
Oh, okay. Never mind.
So, but
I
can
thought
I,
it was
can
linked
I,
from.
No, can I copy and paste it here? Like can I drag and drop it here in the chat window? You know how you can drop files?
Yeah, if it's online. Did you download it from APTA website?
Yes.
Yeah. Mm-hmm.
Okay. So, so this will help you quickly look at if your state is part of the disaster recovery, and if it is clicked yes, then you're good to go. So Maryland is, Illinois is, Pennsylvania is, and which part are you practicing, Mike?
Tennessee. I saw yes. So.
Yes. Yeah. So we are good here. Utah is not. So so that helps us. Like earlier we were thinking of having a compact license in Texas, but also treat patients in Utah. From this, we cannot treat patients in Utah. So that's why it's cross-checking is always helpful.
So much stuff to consider, right? That's why I prefer just doing wellness.
Yes.
I know. I mean, ARPS is asking, what about New Jersey and New York? I'm sure they do, because that's more.
That's more affected, right? Yeah. IJKLM and New Jersey, yes. New York, yes.
There you go.
Mm-hmm. That's
Mike is asking California. I'm sure, yeah.
Yes, yeah. I think all the states that are hugely impacted by COVID would be a yes.
Why would other state not be a yes, like Hawaii or
Idaho?
No. Why would they not say
maybe
yes?
They are not under lockdown. Maybe they are not under lockdown.
Oh, okay. Well, there's something good coming out here, like what I said, a lot of therapists are actually doing this.
Mm-hmm.
The gyms that I go, I mean, not this gym that I go to, but the other gyms that I used to go to, they're providing online services, online group exercise. Imagine that if they're not even therapists, they're personal trainers offering, online services. If they can do it, we're the best people. Not me, I'm not physically fit, but you know what I mean, where we have the knowledge. All we need to do is put ourselves out there and be the voice for our clients, for our patient, and provide these services. And a landing page where you just pay where they can pay. Is they have that too in the Therex Portal, right, Asha?
Yes, yes,
Because
yeah.
that was my main problem before. I didn't know where to start. Where can my patient pay? Where can my client pay? I had to set up my own website, set up my PayPal, Stripe, and stuff like that. And it's just complicated stuff for me, which I don't know. That's why I have a full-time virtual assistant. But with you,
Okay.
Asha, everything is in there, right?
Everything is in there. Yes. So Kelly, right? K. Is it Kelly?
Kimberly.
Kimberly. Sorry, Kimberly. So you have your, Maryland did a good job with your thing. So it has the licensure requirements, and it also gave you like detailed lists of what you have to do, what are the relaxations that they are providing. And also, since you are a speech therapist, you want to know that Medicaid is currently reimbursed, and school-based speech practices are accepting telehealth.
Speaking of that, school-based, Kimberly, I've been getting a lot of emails from, I forgot that company. Oh gosh, I forgot. Well, anyway, it's in my email. It's like a company that provides telehealth services for school, and they pay good money. I mean, it's not comparable to home health or you billing your own Part B, but at least it's better, and you're just at home. You know what I mean? Better than nothing. Oh gosh, I forgot. And you know what's funny? I emailed the CEO. Oh gosh, she's gonna get mad at me. I emailed the CEO and I said, "Can I promote your business in our group, in Alternative Careers Group?" And you know what she replied to me? "Yeah, Michael, I'm inside that group and I know you." I'm like, "Oh, okay. Well, give me some information." But she never replied back. She probably was so busy.
Yeah.
I forgot the company's name. I'll search it later.
Okay, cool. You're well known, Mike.
No.
So, do you how are we doing? Do you guys need a break? Are you hungry, or should we go ahead?
I think I can go ahead. I have my drink here. I'll just let you know if I need to go to the bathroom.
Yeah. So are we doing good, guys? Yeah, go ahead. Okay. So now
We
we'll
got
go.
30 minutes before we go to lunch, right?
Yes, yes.
Okay.
So this is, like I did a demo with Mike the other day, and our demo session is bombarded with these questions. So I thought of adding this, the legal requirements of telehealth practice, and if you were to be a private practice owner. So starting from the basics, let's say, Kimberly, you're into speech, right? So your thought process is you want to improve kids, whatever sensory deficiency or whatever that you think of. You're focusing on that one particular niche, and you're picking a name that truly resonates with you. Like the other therapist, her says postpartum health. So she will pick a name that resonates with her, like we are going to like fitness to pregnant women, or something that resonates with what you do. And then you look up on Google if that name is taken. So if that name is not taken, then you apply that name, and then you first register the name as an LLC. Like you're establishing your own business, you're searching if that name is taken, and then you come up with the name. And you also see if there are any other neighboring physical therapists or occupational therapists that are doing a similar thing. And if your name is too much alike them, if it is too much alike them, you'll lose SEO. So don't do it. Try to pick a unique name that truly is unique to you and qualifies or clearly portrays your particular specialty. And now the second step is to establish the business as an LLC. Some people can do it themselves. And if you are like me, you could go through LegalZoom and have them do everything and take you through this. And when you apply for an LLC, which is a limited liability company or a single member LLC, you'll get a tax ID, EIN number. Okay. And then the tax ID number you would use for your own taxation purposes. Like if you are charging patients through cash based, you want to keep that money separate from, because it's a business expense and you're getting business revenue for taxation purposes, and you'll have some benefits if you are a business owner. So you can apply all that through your EIN. And then this is national NPI number, national provider identifier number. So this is required to stay in compliance with HIPAA and also to issue your patient super bill. And the last step is to get a liability insurance. HPSO, there are a few companies that do liability insurances. And I also listed them out, but we'll first look at NPI number. So this is quite confusing to several people, and I'll try to break it down. So it basically is a provider identification number that meets the HIPAA regulatory standards, and it's unique to you. So it's unique identification number that healthcare providers use, and it improves the efficiency and effectiveness of electronic transmission of health information. So if you are billing your patient a super bill, since your NPI number is associated with your name, so it will be a truly unique identification. And when the patient claims it for, let's say, an FSA spending account or a dependable expense, then he can, then you will be clearly identified through that NPI number. So that's the whole purpose of the NPI number. And the benefits are that if you want to remain in compliance with HIPAA, this is one of the requirements. And the unique identifier helps, like if you are a practicing provider, like what is it called? If you are within the network, in-network provider, so the insurances identify you with the NPI number. If you are private practice too, you will use it for super bill. But if you are within network, then insurances identify you with this NPI number. And it helps effectively coordinate the transactions between you and your patients. And all healthcare providers are required to have this NPI number, even if they are individual or if they are part of an organization. So this is the demarcation between individuals and organizations, and what kind of employees or what kind of professions, disciplines need to have an NPI number. So if you are a HIPAA covered entity, so that includes chiropractors, dentists, nurses, pharmacists, physical therapists, physicians. I believe OTs should also come under there. And if you're an organization, ambulance companies, group practices, health maintenance, home health agencies, nursing homes, pharmacies, durable medical equipments, all these come under the organizational NPI number. So when you apply for an NPI number, this is what it does not do. It does not replace the Medicare enrollment process, and it does not enroll you into a health plan, and it does not ensure that you're licensed or credentialed. It's separate from it, and it doesn't guarantee you that you will be paid through it. So it's only required you to conduct HIPAA to maintain that HIPAA regularities. And if you are a single member LLC, you have to apply under type 1. And I will share this link. I will actually share these slides with you. You go to that link and you apply for a type 1 NPI number. As a sole proprietor, you have to use your SSN and not the EIN. So remember this, only use your social security number and not the employee identification number if you are a sole member LLC, which majority of us would be. And if you are a type 2, which is part of a large healthcare organization like Mike's home health agencies, the home health agency will apply for you for your NPI. And they have 3 types. One is mail-in, one is web-based application, and then there is an electronic file interchange organization where they can apply for thousands of providers at a single time. So I said I would give you the list of liability insurance companies. So a few of them are HPSO, My PT Insurance, and then CMF Group. these give you like liabilities, and when you are applying for this liability, do ask them, do mention telehealth practice to be included in that liability insurance. If we do not ask them, they do not include it. So you have to ask them and negotiate for a better pay to include telehealth practice into your liability insurance.
Yep. What I have is American Professional, and they cover that. So,
So
that's very important. You got to ask that.
you have to ask them because people don't reveal information unless you ask them. So we'll now look at technology requirements. So we are going to divide that into software and then hardware. So if you look at software, so the telehealth software, it should be synchronous. It has to involve two-way communication between you and your patient. And it's always beneficial to have a screen sharing, because if you want to show them some educational resources or pull up some home exercises, you need to have a minimal screen sharing capability within the software. And if the software also has a digital exercise prescription included in it, like a database of exercises, that's a bonus. So I'll give you a few examples of softwares that are HIPAA compliant right now. Doxy.me is a HIPAA compliant software. It does not have the home exercise program. And then Clocktree is another HIPAA compliant software. And Zoom is also HIPAA compliant, the paid version, which is $200. Again, it's not meant for physical therapists, but they are all softwares that you could easily use. And yesterday, I think another therapist told me that G Suite has another video feature, which you have to do some basic tweaks to it to make it HIPAA compliant. So that is also HIPAA compliant if you want to use just a video session that is HIPAA compliant. And when EMR documentation, you also have to use a HIPAA compliant EMR documentation. You can use Google Docs if you purchase the G Suite account and make it HIPAA compliant. Or Intake Q Forms is another EMR platform. HelloNote, which Mike uses, is also HIPAA compliant. And if you are billing purely for cash-based practice, you do not need a billing software. All you need is a super bill, which is already integrated. But that's about billing solutions. And some of these, like Intake Forms and HelloNote, also have billing embedded in them, I think. Is that right, Mike? Does HelloNote have billing?
Yep. They're billing. It's not them. It's a different billing company, but you could go through them and just pay them extra. I used to do it on my own, but I don't know what I'm doing. So I get all these denials. So when I said, well, his name is Steve, the CEO. And I said, well, can you just do it for me? And he said, yeah, we can do it. So for additional $50, I think, a month, it's one of the most affordable. It's not the perfect EMR. Nothing is perfect, guys. Just letting you know. Yeah, I'm sure Therex Portal is not perfect. And if you're going to look for a perfect software, you're not going to find it. Even Zoom. I mean, it's just not perfect. You still get some Zoom bombing every now and then. So HelloNote, it isn't perfect, but it works for me. I'm assuming even WebPT, it's not perfect. So go with what you can afford, and
then you can build up from there. Yeah. So if you're starting out new as a private practice cash-based owner, then I would just go with Google because you have the time right now, and then build your way up. And then when you are ready, when you build up your practice, you can go into the next phase of a complete solution.
So like what to also answer you, yes, they do the billing and for additional $50 a month. But here's my recommendation, like what Asha was mentioning earlier. If you want to just start it, if I'm going to start all over on my own, because I've already set it up, I already have my setup before all this happened like 2 years ago. If I'm going to do it all over again, I'm going to do Therex Portal, and I'm going to do wellness, and then I'm just going to do G Suites or Google, Google. So I don't have to worry about HIPAA. I don't have to worry about the documentation and billing. That's what I'm gonna do. Start from wellness and then go provide therapy services if needed. So, but most of us, we do it the other way around. We do the therapy and then we do the wellness, and now we have that therapy hat. It's just so complicated. Did that make sense?
I think we complicate it. Like EMR, I was speaking with my ex-manager when the documentation is required, like the JCO and CARF rules, all they require is a SOAP note and a pain, pre-pain and post-pain. That's all that's required. And then we have all these licensing bodies adding on like outcome measures, that, this. And then you end up like spending 3 hours at home.
Yeah.
We just complicate it. It always amazes me, like if you look at a neurosurgeon's note in an EMR platform, it's like one page, short and sweet. And we are physical therapists and we are writing like tons and tons of paperwork.
I know.
And it drives me insane,
Mm-hmm.
like what's so complicated in it that we would get sued, and we are so worried that we would get sued, and we added so much work on top of it.
Yeah, that's so true. So, like what you mentioned, I've been doing home health. So I've been doing home health, right? So I'm so used to documenting a lot, like Oasis. So if you're doing home health, comment HH home health, and then now I'm doing part B and using Hello Note. It's just like of one page of not even a progress note, just the one page of what you call this regular treatment note. The progress note is probably 4 pages, but I don't fill up all the 4 pages. And I ask what's his name, Steve, the CEO. I said, is it? This is it? Well, I'm gonna fill up. Yeah, and he said, yeah. Medicare doesn't look at your notes; they only look at your billing. So,
Okay, that makes sense. Yeah.
yeah.
So these are the technology requirements, and then the hardware requirements. So I don't know if you can see this. I have this Yeti Blue mic, which I speak very softly. I have been doing that for all my life. So just to amplify my voice, this helps. I'm sure it's still soft for you, but this picks up volume easily, and it has a small thing on the top which dulls the air coming out. So if you were to do a telehealth practice, and this costs around $100, you could also buy a cheaper one for $70. But if you were to do a telehealth and practice and you're serious about it, you need to look professional. So, and you could use a webcam on top of your desktop or laptop, because sometimes the inbuilt webcams within the laptops are not so good. So, and a webcam you can find for $45. So within $200 and a good light, and you should be good to go. So
That's good.
always use desktop. I like desktop because you can see more, and if you're seeing the patient on the other end, the patient is visible in a larger screen, real estate, and you can pick up nuances of the patient gait or sit to stand or the quality of movement easily. I prefer two screens, because if I share my screen, I don't like to get confused. So while Mike and you are chatting, I'm looking at this window, and then while I'm talking to you, I have my screen behind it. So that helps me, and it makes me feel like I'm talking to the patients, making eye contact with them. So that also helps.
That's good. Thank you for pointing that out. Well, let me also share to our audience my little setup here. Do you mind stopping your screen share?
Yes. Let me. How do I do that? How do I do that, Mike?
Oh, just stop the screen share.
I can only. Oh, I am on a different window. Give me 1 second.
Just click the screen share and then stop screen share.
I can only see you. I can't see me, so I'm getting confused. Can you guys see me?
Yeah, I can see you, but you still have your screen up.
I know.
Mhm. There you go. All right. Okay. So I've been doing this for a while, right? So I have a HD Logitech camera. It's a webcam. It's like $40 at Amazon. Let me show you the difference. Right now I'm using the HD camera, right? So if you want to make this, use this as a living, obviously you gotta project professionalism. Just like Asha, she's wearing a nice suit there. I'm wearing a t-shirt, right? So I'm wearing
You were
pants,
going
but
to bring that up.
you want to project professionalism. So same thing with your camera and your microphone and your lighting. So lighting is very important. So your camera needs to, you might want to invest in a good camera. It's like $40 in Amazon. We'll share you the link later, but just look at the difference. This is my HD camera, 1080p. I forgot the name. Let me see the name. Logitech. Logitech is the name.
Yeah.
So I'm gonna use my regular webcam camera from my laptop. Imagine that. See, it's not really good. I'm fatter. You want the HD camera because look, I can't even see myself, right? And I have all these pores and everything. But if I use the HD camera, bam, I look thinner. I lose like 10 pounds, right? So you want to use that, like, 20, 30 bucks, 30 or $40. Next is Asha's microphone is really fancy. She's fancy. Mine is just the regular microphone that you can buy at Amazon too. It's Audio Technica. It's like $50, 50 or $60. I don't have the fancy ones. This is all stuff. And then I don't have a fancy computer. What I have is just a laptop. Let me show it to you. It's a Lenovo laptop. That's it. That I bought at Best Buy. That's it. I mean, I don't have those big computers like what Asha has, but I'm using it. It's working for me.
It
And
looks
the
good.
reason why I use the laptop, because if the what you call this, the power is off, I can still run it, right? So with lighting, you can use a ring light, what Asha was recommending, but I've been doing this for a while, so there was no ring light before. So what I had is the umbrella light, that umbrella light there. But you don't have to buy that because those ring lights are actually much better. So the umbrella light was before all this ring light started. These are expensive. It's like $100 before. Now you can buy a ring light for $20 at Amazon, right, Asha? And that
Yes,
ring
yes,
light, you
yeah.
can just put it over your webcam, and you look like a telehealth boss already. So those are probably roughly $100.50. Microphone, a camera, and a ring light. And right now, obviously, you're using probably your computer or phone, so you're good to go. You're good to go.
And when you are billing your patients, my friend's father is an accountant. This is what he says. He always calculates like what your liability insurance is, what your hourly rate is, what your overhead cost is, and then you add all that, and then you figure out when you would break even if you see so many patients, and that would be your qualifying cost for a eval or a treatment visit. That's how you come up with the price point. Did I lose you, Mike?
I'm here.
Oh, okay. Yeah. So that also helps you understand how you can come up with the pricing point. And the nice thing about telehealth is that you don't have a lot of overhead expense. It's altogether it came under $200. And if you were to have your own clinic set up, the leasing, the electricity, all those things, it's like a lot of money.
Your home office can be as an expense. Your internet, your telephone can all be an expense for your business. So you get that as a tax write-off. So.
And I also want to mention one more thing in the environment. So if you're treating at home, like your home office, make sure to treat in a private room with less people coming in, because we are still talking to patients on the other end. And if you were to practice in a clinic, you won't bring your family in while you're treating a patient, right? So make sure your children don't jump in, your family doesn't come in because you're at home. You still are responsible for providing the patient the privacy that they need, and they are rightfully theirs. Yeah.
Yep, that's true. That's true. This is a dedicated office for me. You know, it's like I got my, what you call this, my slide there. As you can see, I got all my stuff there, all my books and everything. I got the printer. So this is my home office, literally. So I do all the magic here, all the magic for the courses that I teach, the telehealth, not wellness visits that I do online, and just have a dedicated space to make you as a professional. And it doesn't have to be big. I've seen people who do their visits in their closet.
Yes.
In their closet, because they want that sounding proof. All you need to do is cover it with a black cloth. I have that. I have a white cloth that I used to put behind me here. I used to have a white background, and then I could edit the background, but I stopped being complicated, and now I just do this. Because I have that white background aside from my screen here. I used to have that white background, so I could edit my background. I could actually do it now. Virtual background. See if you can see it. Oh no. See my virtual background there? I would change that. Do you see it?
I see it. Now you're all green. Yeah.
Well, I'm right now. It's not like it's supposed to be white, but you know what I mean? You can do that with a white background, but stop being complicated. You got all the system in place with Therex Portal, with Asha, and start taking action. It doesn't have to be complicated. We have everything. You got the camera, it's much cheaper now. Your microphone, it's much cheaper. The lighting, it's much cheaper. All you need to do is just go out and start seeing patient or providing that services for your clients. So I'll stop talking, Asha.
No, that's good. That's good.
Share your screen again. I'm sorry.
Oh, no. Okay. Yeah.
We're almost on lunch anyway, right?
Yeah. That's good. You're adding value, Mike. You're explaining your experience. I think they appreciate that too. So we went over can you see my screen?
Yep, I see it. Mm-hmm.
Okay. So we went over the technology requirements. And then these are the policies and procedures that we have to have in place. One is the patient consent form, cancellation or no-show policy. Sometimes people take you for granted. Because you're doing a telehealth visit, they don't value your time. So they think they can cancel whenever they want because it's not physically coming to you. But that's not true.
I want to point that out too. That's the reason why I charge up front. I charge $150 up front, and they value that. If it's free, it's okay. Provide a free service. To tell the truth, this webinar, I don't know if you paid or you got it for free for one of our group or whatever. People don't value if it's free. Yes, some people they do, but if you really want to provide, charge what you're comfortable with. Charge what if you're comfortable with charging $50, that's okay. If you're comfortable charging $100 or $150, that's good. I know therapists, they charge $200 plus or $300 per session. And I don't know if you guys attended my ADDC seminar, my CDP class. I charged $247 for that class. It's a 2-day class, but it's an 8-hour class. But you have to provide, some sort of a fee. In that way, if they cancel, they you charge them because your time is your time, guys, and you're providing excellent value. You're not just a guy or a lady in the street there just saying, hey, I'm going to do exercise with you. No, you're our therapist. You're a PTOT speech, and you have a very valuable information to provide to them. So, and that's how you prevent the cancellation and no-show policy. So I'll stop talking.
Oh, that's good. That's good. And then, as I explained, if your patient is a senior citizen, then you have the advanced beneficiary notice if you were to wish to treat Medicare patients. And, this is where we'll take a break. And then in the afternoon, our agenda is to actually go over some examples, case studies of how an evaluation can be done, how a treatment can be done, and also explain you how you can market yourself. I haven't touched marketing, so we'll spend a good bit of time knowing how to market and expand our business into telehealth practice. So that's what we'll be doing in the afternoon session. So I know it's a lot of dry topics in the morning, but I think this builds us towards getting to the next step. So let's be open like for 5 minutes of questions to see if you have any questions.
Awesome. Well, thank you very much, ARPS. Yeah, if you have any questions, put it on the chat box. If not, we're going to go to lunch. We'll let Asha rest and eat some. What are you going to eat for lunch, Asha?
My husband made this. You're going to be interested in it. It's called chicken biryani. So
Chicken biryani?
Yeah. So it's rice layered with chicken, layered with sauteed onions and some spices in it.
Oh, gosh. My wife has been cooking. We went to this Indian restaurant in Jackson, Tennessee, and I said, well, go ahead and try to cook this. So she's been cooking this chicken. Oh gosh, it's chicken curry, but it's a fancy chicken curry. Chicken. Oh, I forgot. So, but it's
Tikka
chicken
masala.
curry. Yeah.
Chicken.
Yeah, tikka masala. Yeah, tikka masala. Yeah. Kimberly was asking what time do we start? Yep, it's gonna be 1 o'clock. This afternoon. It's gonna be. We're not gonna end the session. We're not gonna end the webinar. It's still gonna run. So we're just gonna be here. So if you want to eat lunch, go ahead and eat lunch, and then we'll go from there. So. And Adrian was asking, do we have access to the slides or notes?
Yes. Yeah. Yes. Yeah, I will also give you all the documents that I shared with you that I pulled up on the screen. We'll put them on a Drive link or somewhere, and then we'll share it with you. Yeah.
So if there's no questions or anything, we've got 2 more minutes before we go to lunch. Like what I said, you have to develop that certain niche. Okay. A lot of people are going to go to telehealth already. And what kind of niche are you going to develop? Who are you going to be? Because Asha is a physical therapist and Adrian is a physical therapist. Why would my patient go to me? You know what I mean? So you need to find that specific niche first before not before, but find that specialty. If you're the knee guy, do that, be the knee replacement guy. If you're a shoulder lady, be that shoulder replacement. Somebody mentioned about postpartum, be that postpartum lady, because that's the niches is where the riches are. That's why I don't know who said that, but I've been hearing that. You got to find that specific niche. You can't just be a general what you call this generalist. And even in physicians, doctors, physicians, they have specialty. They have specialty. You go to pediatrician, to a cardiologist for heart, pulmonologist for lungs, and same thing with therapy. You have to find that specific niche. So in my case, it's dementia. And that's the reason why I have that group called Alzheimer's and Dementia Support Group. And that's where I, quote unquote, market myself and provide that, dementia services online. So All right. So, all right. I guess it's 12 o'clock. Let's go ahead and eat lunch, Asha, and we
Awesome.
will see
Yeah.
you guys later. We're not going to end the meeting. It's just going to run, and I'm just going to share a screen with a timer on, and then we will see you after an hour, guys. Okay. Let me put that timer on. Oops. How do I do this?
That's awesome. If you have any questions, you can drop them in the chat window and we'll answer them when we come back.
Yep. I'll talk to you later, Asha. I'm just going
So
to go
Mike,
downstairs.
did you close it? Is that what we did?
No,
And then you will start it?
yeah, I just put a shared screen of a
Timer?
timer. Yeah.
Awesome. Okay, okay. Perfect. So how do I mute myself so you don't hear all the noise?
No, you can't mute yourself. Just kidding. Just so we can hear all your food. Go put your mouse, scroll your
Oh,
mouse on the bottom part, and then you will see that. There you go. Okay. All right. We'll see you later, ladies and gentlemen. Hi, Asha. I'm just here if you need anything, okay?
Sure, Mike. I'm here too.
How's the weather there by the way? Is it too
It's a little chilly.
uh-huh? Ours is right now at 60 degrees.
Pardon me?
60 degrees.
1 second, Mike. I am playing something and I don't know where it is and I'm trying to find it. Oh, I see. Okay, go ahead. Yeah. You were saying something, Mike?
No, I said ours is like 60 degrees right now.
60. Yeah.
Yeah.
I
It's
woke
the sun is up, but it's cold.
It's
So,
cold, right? Yeah.
yeah.
I woke up early at 5 o'clock today
Oh wow.
and I went for a walk. Uh,
Good for you.
but it was so chilly. I usually walk for like 45 minutes,
Mm-hmm.
but I couldn't walk. I only walked like for 10 minutes max and then I came back. It's so cold.
Hmm.
Yesterday was beautiful. I don't know how it suddenly changes so fast.
I know, right?
Yeah. How is Philippines? Is it warm?
Uh
Is Philippines warm?
yeah. It's pretty warm.
Yeah.
Very tropical.
That's awesome.
How about in India? You have
It's
winter there?
uh, we do, but it's like spring here.
Oh. Okay.
I live in the southern part, the most temperate part,
Mm-hmm.
so it's not as cold. So even in India, like how we have different weathers, different climates. So in the northern part, you'll have snow.
At least you get to see snow.
Hmm.
We don't in the Philippines.
Yeah, to go to the mountains to see the snow.
We don't have any snow there in the Philippines.
Temperate climate is
Uh,
good, like it keeps you
mhm.
mind sharp and it's good.
If you really want to see snow, you have to. Closest probably is Hong Kong.
Hong Kong, yeah.
Hmm.
Have you been to Malaysia?
Yeah, me, Malaysia. Yeah,
Hmm.
very warm.
Yeah, but it's clean. What I noticed is that it's the roads are clean. Facilities are clean.
Have you been to Malaysia?
I've been to Malaysia once. I was invited to teach and participate in like a scientific conference. Um,
Oh,
so
good.
that's how I went. I liked it. It's a small country.
Mm-hmm. Yeah, I've been there once too. Once too.
It's
What I
48
really
right
like
now here.
is Singapore. It's there. It's pretty good.
It's happening, right?
If I'm gonna.
Yeah.
Mm-hmm.
When we are about to start, I will have my son turn off the TV. It's right now noisy.
Oh,
He's
do you
watching.
have? Is that a private office that you have there?
And no, it's kind of semi-private. Like it has a thing. But my son is home now, and he
Mm-hmm.
turns the TV pretty loud.
How old is he?
He's 10.
10.
Mhm.
How many kids do you have, by the way? Forgot
One,
to ask
one,
that.
one son,
You only got
one child.
one?
Yeah,
I got three.
you have
So.
three, right? I know.
Mm-hmm.
Yeah, I see pictures of your kids on Facebook.
Mm-hmm.
They must keep you busy.
Oh yeah. Well, I mean, they're all good kids.
Yeah,
I don't
yeah,
even have to worry about a thing.
yeah, yeah.
Uh, They're very, very good kids.
Mhm.
Sometimes I worry. They're so good.
And
I'm looking at the map right now.
the
I've been- So India is right below Nepal. I know some of my physician friends here are from Nepal,
mhm.
but they look Indians to me.
Yeah, India, Pakistan,
Hmm.
even Middle East people also look like Indians, don't they?
Hmm. Because they also had the bindi in their forehead,
Yeah, yeah.
and I thought they were Indians, and said, "No, we're
Nepal.
Nepalese, Michael."
And then Sri Lanka also looks like that. Sri Lankans also look the
Hmm.
same.
Where is Sri Lanka?
Sri Lanka is the bottom of India, all the way down, right, the tail of India.
Oh, is that a different country or part of India?
It's a different country. It's a,
Oh.
it's called Colombo. It's a different country.
Hmm.
So how are we doing so far, Mike?
Well, holding up, obviously my reimbursement is all the way down. Uh, I think I only have like two active, I think just one actually, one active Medicare right now. The rest are put on hold because majority of my patients are in the assisted living,
Mm-hmm.
and they won't let us go in, um, so I'm not even going there.
Mm-hmm.
So there's no money coming in, but I still see those one or two Medicare patient at
Mm-hmm.
home,
Mm-hmm.
and then I have some cash paying patients,
Mm-hmm.
and I have some contracts from home health agencies.
That's right. Oh, okay. You were
Or,
saying that.
yeah,
Yeah.
the
Mm-hmm.
DIDD,
Mm-hmm.
but nothing really big right now. At least we got money, some money coming in, but nothing really big. Good thing we got a little bit of savings, a little bit to survive.
Mm-hmm.
Uh,
How long do you think this will last?
that I don't know. Government can even tell us, right?
Yeah, it's going for too long.
I know it's an evolving thing.
Mm.
It's just a matter of us how we are going to adapt to it because it's going to stay. Coronavirus is going to stay. She's
You
going to
know.
be here, so it's up to us healthcare practitioner how to handle it.
Mhm.
How to properly don and doff our PPEs and using the right way or doing the right way how to take it off, because when you go to at the hospital they really check how there's a spotter
Mhm.
where you take off your PPEs and everything. But in the nursing homes, oh, I doubt. I still go to the nursing home and the psych hospital, and if you're gonna really be really meticulous,
Mhm.
be vigilant on how you take off your PPEs
Mhm.
and how you're touching all the surfaces, oh,
Mhm.
you're gonna be tagged. If you know
You know,
if
yeah, that's right. One of my pet peeve is that in the grocery store, people come like wearing gloves and then they touch everything.
mm-hmm, yep,
I'm like, I can't say enough about it. Like they
yep,
think since they have gloves, they are protected themselves, but then they, with the same glove, they are touching every single object.
yeah, that's true. That's true. Now we got 6 more minutes, and like what I said, if you, we're trained. Even if you're really going to be gonna in the hospital I used to work at, we had a very very strict infection control lady, and I did wound care on our outpatient clinic, and there was a step, there's how to take off your mask and everything, and now they let us reuse those same masks.
That's awesome. Right.
Uh-huh.
I know. Yeah.
I told them it's just like you're telling me to reuse these gloves.
Yeah,
You
yeah.
know.
It's like I don't understand how the government spends so much money, but then doesn't invest in PPE. You know, it's like I don't understand the logic behind it.
And I'm there, and I do it all the time. That's the reason why some of my patient that I see for Part B, they still let me come in, because in the very very first time I'm there, I have a paper towel that I put it over my bag. I have gloves, and I explain to them, and I clean before, during, and after while I'm seeing them. I have my own Clorox wipes, and I've been doing that before all this happened. And
Right, right.
they would always make fun of me. Huh, you're so clean, Michael. You don't have to put that paper towel and everything. You don't have to wear gloves. And I said, no, I have to do this to prevent, cross contamination when I go to another patient. And the bag technique in home health, I do that regularly.
Can you start
And
the video?
and
Yeah.
now I'm doing it. They see that I'm doing it. They said, "Oh, Michael, thank you for doing that." So
Right.
so if we've been doing it the right thing in the first place, we wouldn't be in this situation.
Right, right, right.
But
Yeah.
it is what it is. It's
Yeah. Give me a
uh,
minute, Mike. I'll be right back.
yeah.
Mhm.
We got 4 more minutes.
Yeah, yeah. I'll be right back.
So if you are back, Abby, I know you're back. Adrian and Kimberly, thank you very much for hanging in there. So we've got 4 more minutes before we start torturing Asha again. If you are back, comment you are back on the chat box. Back. If you are back, there you go. Kimberly says, I work at the hospital. Fortunately, we have, there you go. Kimberly, that's good. It's nice to hear. Do they let you reuse those uh, masks? Oh, they let us reuse it. It's just crazy. They ask us to put it in a paper bag, brown paper bag, put our name on it, and to reuse it. And I just don't know. So it's just crazy. Well, at least it's for the day only. So it's just crazy. And I just shake my head. So, hey, Drain is back. There you go. At least it's good. The shield, we are supposed to, yeah, the face mask, or what do you call this? That face shield. Yeah, we clean it too. So, but still, before that this didn't happen, we can dispose everything, right? Even the yellow gown, the gown that we use, the nursing home that I go to, they wash it. So before we could use the actual disposable gowns, they let us use the the patient's, not the patient, the patient's hospital gown first. So, but it is what it is. So, and then we just got this letter from Governor Lee here in Tennessee that we, obviously, all non-essential surgeries canceled and everything, and we have to redirect all the resources to the hospital. He said something like that. It's in a letter, and that you could be sued if you have supplies or still see patients who are non-essential. So that's my big question is my home health visits still essential? You know what I mean? So I don't know. I'm just playing by ear. And right now I only have like 2 Medicare patients that I see at home for my Part B. So hopefully with this telehealth system, we could scale it in a bigger way, because there's so much opportunities here, doing telehealth instead of doing one by one. Let me stop this. It's 12 o'clock already. Let me start that. Stop that. Let me stop my share. Asha, you can share your screen.
Sure. Yeah.
But for if you are back, comment you're back. If I ate lunch too. What I ate, I've been trying to lose weight. I've been trying to lose weight, Asha.
You
I've
are.
been gaining
I am.
weight.
I am. I am. It's a losing battle to me. I try to lose weight, and then COVID came. Now I can't go to the gym. Now I can't
I
lose
know,
weight.
right? Blame that to the COVID, right? Well, anyway, even though there was no COVID, I was still gaining weight anyway. But
Right.
now I bought some shake from
Mm-hmm.
I don't know if you know Katie Henry. She's one of the coaches in the Alternative Careers Group, and she's
Mm-hmm.
like the
Fitness.
healthy living lady, something like that. So I bought some shakes from her
Uh-huh.
and some caffeine stuff,
Uh-huh.
some tea. It's like $300 of products,
Oh,
and I
okay.
bought it, and I've been taking it. So I started with 220 pounds. Now I'm down to 210, 211
Oh, that's
this
good,
morning.
right? That's good.
And it's been
Yeah.
like a week,
Oh, within
but
a week you lost 9 pounds. That's a
yeah,
lot. That's
I've
that's
been
that's.
drinking the shake, just shake. I drink it before I eat.
And you don't
So
eat?
before I eat,
Okay.
before I would eat a lot. I could eat rice all day long,
Mm-hmm.
and then now I drink the shake first, and before I eat the rice, it's very little. So I'm already
Okay.
full drinking the shake. So
Okay.
hopefully it keeps going. All right. So I think it's 1 o'clock your time. It's 1:02, and I'll let you take over again, Asha. So again, if people are back, Adrian, Kimberly, and again, this is all recorded in our remote therapy summit. So you can take over, Asha.
Sure. So everybody's back, right? Can you guys hear me?
Yeah, I can hear you. Yeah,
Yeah,
not
yeah.
all, but you can go ahead and
Sure, sure. So before we start, I wanted to let you know that I shared a link in the chat window. So of all the documents that I have been showing to you. So if you, it's a OneDrive link. So if you click on that link, you'd be able to see a folder where you can download all the documents from there. So you got it, right?
yeah, I'm going on it right now.
Okay, sure. So we were talking about the patient consent form, cancellation or no-show policy, and the ABN. So now we will go into how to evaluate a patient. So by the nature of telehealth, we have certain limitations. Let's say if you have a back pain patient, right? So if if the patient with back pain comes to your clinic, then what you do is, you palpate the spinous process, you ask them to do extension, and then you put some thrust over it. You see like where the pain is, which segment it is, and you're able to localize it. So with telehealth, there are some pros and there are some cons. So the cons are that you cannot use any of your manual therapy skills or your palpation skills on the patient. So the pros are the you can engage the caregiver, you can engage the family, you can engage the patient, and you would see the patient in their actual environment at home. So when the patient comes to us to the clinic, especially the neuro patient, we do not know the obstacles that they have at home. Although this patient had home health therapy a long time ago, they have been discharged from home care therapy for a long time, and then the environment and the home, they may have a lot of throw rugs, or they may not have the when they're practicing transfers, they may not have the grab bars at the right height, or they may not use the wheelchair the right way. So you'd be able to evaluate all that if you are seeing the patient at the home. And also in the home, the kitchen counter is like the homemade parallel bars. So you can use the kitchen counter to train balance exercises, or to have it as a guarding environment to the patient, so you can progress the exercises from the kitchen counter to moving away from the kitchen counter. So you really have a keen sense of the environment that the patient is living in. You also get to engage the patient as well as their family a lot, like the caregivers a lot. And what I personally noticed is that patients take more responsibility when they're treated through telehealth, and they do their exercises uh, more diligently compared to when they come to you. Because when they come to you, they think that, I had my therapy for today, and then they don't exercise at all. So you don't see the benefit of as much benefit of the therapy. You would see some progress, but not to the extent that you like to see. So those are the pros and cons. So knowing that, we also have to modify our evaluation and our treatment skills accordingly, so we can still be successful. So since I'm a neuro and vestibular therapist, I'm going to give you two case studies. So the first case study I will describe, and the second case study we will discuss together, so we can come up with ideas and treatment strategies. So in the first case study, I'm going to give you a detailed history, how you could document in G Suite, and then how the subjective measures would be beneficial for us, like would give us more information regarding our evaluative skills. So if we look at subjective outcome measures, so I have listed down, again, I did not add women's health to it because it's not my area of expertise, but I listed down like the primary conditions that we usually see as physical therapists. So if you are having a low functioning patient, like a patient who is wheelchair bound, we can do, we are only talking about subjective measures here, not the objective measures, the self-reported measures by the patient. You can have the patient fill out a patient-specific functional scale. If the patient is having balance issues, unsteadiness, or frequent falls, then you can have them fill an ABC or a dizziness handicap inventory, activity-specific balance confidence scale, or dizziness handicap inventory.
Can
If
I
the
ask a question, Asha?
uh-huh.
This whatever you call this standardized test stuff, is it included in the Therex portal?
It is not. It is not.
No.
But if you are using G Suite, you can actually attach it to your. This is what we are. These are the list of outcome measures that we plan to include.
So for now,
we
we
don't.
ask the questions to the patient. So for example,
you send this to the patient through an email.
Okay, and then
I'll
they
give you,
that.
and they fill that out and then send it back to you.
Okay, all right. So nothing. Okay, so just regular email.
Regular email. So if you use G Suite, it is HIPAA compliant. So you can send it through G Suite. And if you set up an Outlook account, that is encrypted by both standards. Like if the patient sends you any email that's encrypted, you send an email out, it's also encrypted. So it has dual encryption. So you could use a standard email, but we plan to include these into our phase 2 of our development.
Do you think someday you can also provide an email through your Therex portal?
We currently send, we do send patients emails, but we don't receive emails from them.
Because that will be a good additional service, right?
So when the therapist sends a notification message to the patient, it goes to the patient's email. If they are invited to the call, it sends them an email. So we have email encrypted in our system, like and text messaging that is also included, but we do not
through Therex portal.
Through Therex portal, yes.
Oh wow! Okay, well but that answers my question.
But we do not receive the emails, because if you do not have compliance as your own personal email, then it breaches HIPAA. So you can
Oh.
see the patient's response in the platform itself, but not to your personal email.
Okay. All right.
So if you're looking at these outcome measures, so for concussion, you could do the river meet post-concussion, neck pain, neck disability, or Swiss strain, knee outcome survey, LEFS, pen shoulder score, and DASH, and foot and ankle ability measure. So the reason why I like outcome measures, the subjective ones specifically, is that before the patient comes to you, let's say a patient called me and informed me that he's having frequent falls or he's being more unsteady. Then I know I have to give him an ABC or a DHI. The patient fills that out, sends it back to me. And from the ABC and DHI, I know if the patient has problems with motion sensitivity, if he has problems with vestibular organization, or if he has problems with sensory organization. So based on that, I would next evaluate the physical outcome measures. And what outcome measures we will evaluate, I'm going to show them to you with the platform itself. So think of these outcome measures, and if you can have them handy, you can send them to the patient ahead of time along with the past medical history. So you can target the patient better during, and you'll be better prepared for the telehealth visit. So let's say detailed history is a key. So that's your winning success. And these subjective measures provide you valuable information. For example, I'm seeing a patient with concussion. By filling up the dizziness handicap inventory and river meet post-concussion symptom, it will give me valuable information as to what objective measure I have to choose. So this is the patient who is a 39-year-old female patient who suffered a concussion 4 days ago while she was sitting in the soccer field, and then she's watching her son's game, and a soccer ball came and hit on her head. So that's how
that lady is so lucky.
Yeah, that's how. This is actually a true patient. So
really?
So that's how she had a concussion. And looking into the past medical history, she's actually 39-year-old, very active, healthy female, no blood pressure, no hyperlipidemia, nothing, and she doesn't have any medications. She doesn't take any prescription medications, and no comorbidities. She's active, healthy, fit. So now, since I have a vestibular specialty, I asked her further confirmatory questions as to does she have a history of migraine. If she does not have a history of migraine, is there a family history of migraine? Is she on any birth control pills or anything? So these provide us some more information as to the recovery of the concussion. So this is her present chief complaints. So what she says is that her headache is at a 4 out of 10, and she has eye strain, and the headache worsens as the day progresses. She denies nausea and dizziness at the moment, but she also feels cloudy in general and has delayed time processing, like she takes more time to process information, and she's in general slow. So those are her current symptoms. So I made her fill the DHI and river meet post-concussion symptom questionnaire. So this is the DHI. Can you guys see it well? So
I can see it, but
not clearly.
It's small, but it's good.
Okay. So what it asks is, does looking up increase your problem? She said sometimes. And then does your problem significantly restrict your participation in social activities, such as going out to dinner parties? She said sometimes. And do you have difficulty reading? She said sometimes. And performing more ambitious activities like sports or dancing cause symptoms? She said sometimes. And do quick movements of head increase your problem? She said always. And is it difficult to do strenuous housework or yard work? She said always. And difficult to concentrate? She said sometimes. And does bending over increase your problem? She said sometimes. So based on this, the total score is 22, and she has mild handicap. But if you look at these symptoms that she has reported, you can see that most of the symptoms are related to head movement. So quick turning of head, bending of the head increases her problem. And also when she's doing strenuous activity, she's having problem, and she has trouble concentrating and also trouble reading. So what we can infer from this is that she may have some oculomotor impairments, and she also has some may have some vestibular organization difficulties, because quick movements of head and bending, lifting, motion sensitivity problems. That's what she's reporting. But they are to a milder extent, not severe extent. So these are her present symptoms. So this gives me valuable information as to how I need to direct my plan of care. So as I said, if the dizziness handicap inventory suggests those are items, that bending, turning over in bed, if they are highlighted, then I would choose the next outcome measure is called motion sensitivity quotient. So motion sensitivity quotient, just to bring it in a very clean, simple way, asks the patient to what their baseline dizziness is on a scale from 0 to 5. And when the patient turns over, it asks how much the dizziness increases and how long does it stay there. And then when they're bending, how long does it, how high does it go up to and how long. And when they are turning, like standing up and turning, it takes the patient through certain movements and is basically evaluating how high the dizziness goes up to and how long it stays. So all you need from the therapist end. So if the patient, what you would do is you would have the laptop set on a table and you would have the patient on a bed and you'll have the stopwatch in your hand, or Mike turned up the stopwatch on the screen, right? So if you can turn the stopwatch on the screen or you have a stopwatch in your hand, you are asking the patient clearly, what's your dizziness right now on a scale from 0 to 5? The patient says 1. You write down 1. And then when they roll over in bed, did you have more dizziness turning to the right? She says yes. So it's you start when the dizziness starts and then you stop. So it takes 10 seconds for the dizziness to come back to 1. So you note that down. And then if the dizziness goes to 3, then the value is 2. So there is a calculation to it, but all you need is a stopwatch and you being able to see the patient. So here you have a vestibular evaluation form thoroughly done, and you have both the physical outcome measure and the subjective outcome measure. And you can also do some careful observation of her eyes as she is doing smooth pursuits or saccades, or if her VOR is impaired. I'll show you actually an example of this.
Asha, before you keep going, have you had any patient? I mean, sounds fancy to me, because I'm not a vestibular therapist. I do this, every now and then, but nothing really fancy. I guess, what if there's an adverse reaction, just extreme dizziness, blood pressure issues, and, have you had any instance like that you had to call 911 or
no, not to the patients that I see. But that could be quite a possibility. So if you are seeing, now you see mostly home health patients, right? They are sent home even before they recover completely. So it used to be the other way around, but now they are sent home quicker. So it can happen. And if you're seeing a patient with stroke, they could have a recurrent stroke. So at that time, and also if I see any signs of central signs, even in this patient, I would stop my evaluation and ask her to see a doctor. So that's what I would do. So you can sometimes evaluate the central signs through a careful observation or evaluation. And anytime when in doubt, just stop it and refer out. It's always better to be safe than to be sorry.
Amen. Okay.
Yeah. So and then I will show you, I think a video will help. And then if the patient reports unsteadiness or lack of balance, you evaluate timed up and go. Have the patient stand next to like in the corner of a wall, and then measure semi-tandem, tandem, eyes open, eyes closed. If the patient can still do it and you're progressing to the next reevaluation, you can have her stand on a pillow, eyes open, eyes closed, and then add head turns to it. So you have clear-cut information. I know you are not doing a fancy balance master and all that, but whatever the balance master tells you, you can get like simple information through the telehealth visit, and it can be objective, it can be quantified, and if you are doing the same measure again, it is reliable, it is valid. So the subjective outcome measures have a good reliability and validity if you choose the right one. So they add a lot of value to our evaluation. So let me actually show you the evaluation of this patient. And at any point you can stop me. I know it may not be your area of expertise. We will again go with a easy one, which is balance the next time. This is actually a friend of mine. I do not like to actually record my patients. So I don't record it. But since she's a friend of mine, I was able to do that. So I'm going to mute this and I will talk you through it. So here's this webinar. If you remember, Mike, we did this a long time ago with our friend, at Dallas.
Yeah.
Yeah, so it's from that, and since then I've been preaching telehealth. Now people are listening.
There you go.
But if you look at this, the policies are the same even with COVID or not, or even if you don't have COVID. So you verify if you're active, if your state is actively issuing license. Right now, most of the states are exempt. You understand the state practice guidelines to telehealth, and you identify the patient needs to be able to verify your license. So if you can guide them to the FSPPT site, just like you verify your patient's identity, your patient also needs to be able to verify your identity because they're not seeing you in person. So give them the FSPPT link so that they can verify your license, and you provide them an informed consent to treat, verbally and or written, based on your state's practice act. If you get a written consent, then it supersedes the verbal consent. And you have to make sure the software that you are using meets HIPAA, High Tech and Affordable Care Act. And you should have all the policies and procedures in place to prevent unauthorized access of PHI. What I mean to say is that if you're using your laptop, right, you turned it on, the patient is on the other side and you walked away, and your child or your husband comes in and then he sees the patient, that's a breach in HIPAA. So you need to have procedures set in place so that you are in a private room and then there is no family around. And when the patient is talking to you, it shouldn't be heard to the outside people, because your patient is confiding to you about his or her personal health condition. And if everybody is able to hear that, then you have breached HIPAA. Sometimes when you get audited, people ask you these questions. How are you ensuring that the information is not spread outside if you are working from home? So these are certain things you need to write down as if you have a clinic, so that you can, when you get audited, you can explain that this is what I have done. So here is a patient with concussion, and she's 39-year-old, and I'm asking her the history, and she's explaining to me about her history. And before I start the session, I make sure I help her understand the limitations of the telehealth visit and her right to ask questions at any time during the visit. And I finally ask her if she agrees to participate in the telehealth visit. When the patient gives a consent to participate, that's when we initiate the subjective measures. So here I have asked her to fill out the Rivermead post-concussion questionnaire.
So before you start, Asha, so she's using a phone and you're using your Therex platform, right?
Right.
And,
yes.
Okay.
Yes.
So she's just using her regular phone, right?
She has the phone in front of her.
Okay.
Yeah, she's
Right.
using an iPhone and she kept it in front of her.
Where is she based at? Is she in India?
No, she's in Illinois.
Illinois? Amazing. See?
Yeah.
We can do this, right? We can do
Yeah.
this, ladies and gentlemen. All right, I'll stop talking.
Yeah, she's based of Illinois. So, and she's a friend of mine, so I was able to record it. So I'm asking her the history, and she's explaining her like where the soccer ball hit her, and what she felt immediately after the concussion. And I asked her if she had any loss of consciousness during the concussion, and she said she didn't have any loss of consciousness. And I'm asking her about the symptoms, headache, nausea, and fatigue. And she's explaining that she is having eye strain. She feels dizzy and blurry at times. And I'll show you the nystagmus shortly. You could also see it there. And I've asked for any of my concussion patients, I asked them if they have neck pain, because most likely when they have concussion, they hit their head and then they have a whiplash injury. So it's also crucial to rule out neck. And people have emotional disturbances with concussion, and she said she doesn't have it. And she denies any visual changes. And I asked her if when she rolls over in bed, if she has any dizziness. This also is another factor to consider, because when you get hit on the side, you can jolt the vestibular system and shake the crystals out. So she denied any of those symptoms. And now, right now, I'm evaluating her neck. So I make her sit up nice and tall. So corrected her posture first. And I'm asking her to turn the head right to left. And I asked her if she has any neck pain with it. And she said no. Now I asked her to extend, which she has pretty good mobility there. So no pain with that as well. That's what she's saying. And she denied any neck pain or any symptoms of dizziness. Sometimes you can have cervicogenic dizziness, but she denied any increase in symptoms with the neck movement. And now what I'm asking her to do is to, actually I'm tracking her smooth pursuits and ocular mobility. And if you watch it slowly, okay, so as she's going in the vertical plane, okay, so watch her eyes slowly. You'll see some nystagmus there. I can slow it down. Do you see it there? Maybe it's hard to watch, but as she goes up, you'll see the eyes jump. Do you see it? So so that's a central sign. So pure vertical nystagmus is there you can see it again. So she has
the. See it? Where do you see it?
So here. So just look at the eyeball, Mike, and there. You see the eye jumping up and down.
Oh, okay.
So that's a vertical nystagmus. So if the nystagmus rotates, then that's BPPV. That's torsional nystagmus. So if you have nystagmus in the vertical plane, that's a central sign. So if you have nystagmus in the end range, that's okay, because you have end range nystagmus. But if the nystagmus reverses direction, that's again a central sign. So you have a downbeat nystagmus even in vertical plane and horizontal smooth pursuits, which is a central sign. So I didn't treat her too much. I actually had her go see the doctor. And history of migraine is important here, because pure downbeat nystagmus you can also have when you have a history of migraine. So and her past medical history, I asked her if she had any earlier concussion or head injury, and she denied it. So and if you look at this, I usually do this evaluation with Frenzel lenses. But since you're doing it online, you can still see, if you are a good clinician, like if you have experience with it, you'll still be able to see and appreciate the symptoms, and you'll pick up like nuances that the patient has. Here I am testing convergence, like her ability to focus on an object closer and farther. And she said it did not provoke headache. So that's what we are looking for. And here I used a playing card, and I have her do VOR, which is side to side head movement. The reason why I chose these tests is because of the River Maid post concussion. She said she had symptoms in that before. Where did it go? Okay. Let me open it up. 1 second. You done it? Not yet, Nikki. Sorry. Yeah. So it's here. So then I go on and ask her if she has dizziness with it, or if she feels like unsteady. And then we are looking at saccades and all those things. So I'm not trying to train you on vestibular, but I'm just explaining you how we can do a detailed evaluation and still get the patient's information and be able to treat the patient online. If you think of a vestibular evaluation, it's kind of a little tedious and extensive to look at and to identify, but you are able to do that with just a visual one-on-one screen with your patient, and all you needed was a laptop and the patient needed a phone. And when a patient has any health condition, I believe a lot on, I'm just going to skip that. I believe a lot on education. So we have like a detailed educational handouts that are available to the patient for them to learn about the health condition, like dementia, dizziness, vestibular problems, knee pain, hip fracture, anything that you can think of. So we share the educational resources, and this is our home exercise program platform that I have used. So having an inbuilt home exercise program makes it easy for you to train the patient on the exercises. Let's say you're treating a patient with low back pain. You cannot leave the computer here, go find a bed, lie down on the mat, and then show them a prone extension. If you can have a exercise platform inbuilt, you can just share the screen, demonstrate the exercises, train them, and then correct them while they are practicing the exercises. Here I am showing her how to perform a smooth pursuit. And if you look at the patient, Mike, it was hard for you to visualize, right? The nystagmus. But if you look at this video, it would help you understand how a smooth pursuit looks like. Wouldn't you say so?
Yeah.
Yeah, it's easy to learn, and from a patient's perspective, even if the patient is disabled or has cognitive limitations, it's easy for them to pick on it and understand rather than watch you do the exercise and miss things. And if you are using a good home exercise program, it also shows you, if you look at this exercise, we are having the patient walk and turn side to side. So it will show you how the environment needs to be while they're practicing the exercise.
Can the patient see that?
Yes. I will, at the end, I will demonstrate the exercise for you. I mean, the platform to you. The patient, you share the link with the patient, and it's a store and forward and also simultaneous. So the patient can see the exercise while you are sharing the exercise. And this is how the patient's portal looks like. What I'm showing right now is the patient performing the exercise. And then I share the exercise platform with her. And I'm right now asking her to share her screen. This is her screen. So the patient can record the pain if she has any pain, and the patient can send you information through the platform.
It's running too fast. Are you really running it too fast?
No, it's
playing it too fast.
No, I will stop. Yeah. So here, as the patient performs the exercise, if you click complete, it will give them a gamification tool. And then here, as the patient completes the pain scale, it's a Wong-Baker Faces pain scale. It sends to the clinician, and the clinician can see it from their end. I will actually demonstrate the platform.
Okay.
This is a recording from the previous patient, which I didn't do a good job at recording. So, but I will show you the actual application.
Mm-hmm.
So, so through this, what I would need when I'm documenting is the subjective measures, the objective measures which we have. So in a SOAP note, right? So this is the subjective report, right? Headache on a scale from 0 to 10, worsening of headache, denies nausea, also reports feeling cloudy in general. These are our subjective reports. And the objective reports are our DHI, Rivermead, and also, what we could do with this patient is we can also document her nystagmus and timed up and go. So to measure the timed up and go, as you are having your patient sit in a chair, you would demonstrate the exercise, or you can show them a video demonstration of the exercise, and you ask the patient to measure 10 feet, walk, turn, and come back, sit down. So with this patient, we also measured balance. So when we measured balance, we had her stand in the corner with eyes closed, feet together, and you time the amount of, and you basically use the stopwatch to time how long she can stand still without having a lot of postural sway or losing her balance. Since the patient is in the corner of a room with a chair in front, you know that the patient is not going to fall. So you have to make those adjustments while you are evaluating the patient to ensure safety. And for my low functioning patients like stroke and Parkinson's, I always take the help of a caregiver. I even have treated like patients with spinal cord injury with good caregiver support. So caregivers, play a huge role in the progress of the patient. So these are our objective measures that we measured: timed, tandem, semi-tandem, and observing and documenting postural turn, like postural sway with head turns while the patient is standing with narrow base of support. So, and for the balance, we used the environment such as the corner of a room. And as the patient progressed, we used pillow to make her stand on the pillow. And then we had her close her eyes and also do the head turns. And, we asked the patient to, you could ask the patient to like increase the speed of walking, resume to a slow jog, and progress the time that she's able to exercise. And, these are like the outcome measures that you could do. You may not be able to do a functional gait assessment because I don't know if I could trust the caregiver, especially if the patient is low functional. So I tend to refrain from FGA, but I do use the timed up and go and the 5 times sit to stand quite a lot. So does this make sense so far?
So when you're doing that, Asha, are you basically showing it through the Therex portal, right?
Yes. Why don't I?
You mentioned earlier sharing screen. You're sharing your screen through the Therex portal, right?
Right, yeah. So the Therex portal has both the tele-rehab interface as well as the home exercise program interface. Okay. So this is
where are we going now?
So we are in the tele-rehab interface. Okay. So I will just show you.
So that's you as a clinician.
This is me as a clinician. Mike, what's your email?
Mike at TN outsource outsource.com.
So I could also send you a text message where you will be able to activate the link from your phone. So I'm inviting you.
So you're inviting me as a patient, right?
As a patient. So here, if you see, this is the consent form that Mike will be filling out. So he will be adding the location that he's residing at and his date of birth. You got it, right? Yeah. And he will sign here and he will agree to participate in the telemedicine consultation. So any consent form should have the purpose why we are doing this, where we are located. So right now I'm located in Pennsylvania. So it says I'm in Pennsylvania. And if Mike is in Utah, where we know that telehealth practice does not allow us to treat, then before we even initiate the call, we can already verify and we can call Mike and say, Mike, we are sorry, we cannot treat you. Okay. And you do not need to give your patient any consent form. It's already embedded in the system. You have the confidentiality rights and disputes and the risks and benefits of telehealth consultation. And then the patient agrees and then checks, and then the date and time auto-populates when Mike completes his consent form. So when Mike
agreed.
You clicked agree, right?
Yeah.
So when Mike completes the consent form, you see the status change to free session because I gave him a $0. But if he has to pay an amount, then all I have to do is I have to add like $50 or $100, and then it would take to the payment settings, and then I get billed through the Stripe account. So the charges get automatically credited.
Online now.
Yes, I did not activate it because I'm using this camera. But
okay.
So if I activate it, this camera will shut down. But I can, but you can already connect through me. So if I click join call here, I would be able to join Mike's call.
Oh.
And once I treat Mike, all I have to do is, I have to add the diagnosis ID, the procedure code that I am treating him, neuromuscular EAD or telehealth or whatever, and then the fee and number of units I billed him for. And if I fill this and send it to him, it automatically goes to him.
I didn't even download anything. So
you don't have to. So
can you practice? Can you show me too?
So we will just ignore the video here for a moment because we both will be connecting. Can you share your screen, Mike? Because you have two cameras.
I'm in my cell phone.
Yeah, you share your Zoom screen because I will be connecting here. Why don't you open your Chrome window on your laptop? You have two webcams, right?
No,
you have
I'm using the phone when I consented from you.
So should I share my screen then? That's right. I will share my screen.
Yeah, share your screen.
Yeah, it's already sharing. So what we will do is I'll join Mike's call. So I think this webcam will disable, but you can ignore it for now.
Yeah.
So it asked me to use my
microphone. That's me on my other phone.
So that's it. Because we are talking twice, you can hear resound, but the call quality is clear.
Hey. On the other side.
The call quality is clear and everything gets activated.
Okay. There you go.
So I'm going to, so here.
You can see all my face there.
Yeah, it's a HD quality. So here I can share my screen. You can see that, right? So if I click that, I will share my screen.
Okay, I see it now. I see it in my cell phone. Okay.
So that's where I open the exercise platform and show the patient the exercises.
Okay.
And you can mute yourself, unmute yourself. You can turn the video on,
So it's
video
just like
off.
Zoom too, huh?
Yeah, and then if you click the red button, it ends the call.
Oh. The only thing I don't like, it sees all my facial holes.
It's too clear.
Oh well. Now you see the difference, right? Okay. Well, I'm gonna put this phone down. It's showing all
Yeah.
my flaws. Okay.
So we
It's
are going
nice.
to end the
I don't know.
thing.
Let me show it to you guys. That's what I'm seeing. I'm seeing a screen, a shared screen. So it's really nice. Okay.
So that's it. So I'm going to end this call here and come back to Zoom. So can you hear me, guys?
Yeah, I can hear you.
Okay, perfect. So the reason why you're hearing resound is because we are talking on two different systems at the same time.
I didn't even hear a feedback, so you're good.
Okay. So I could hear myself twice because I'm talking in two different platforms, but this is it. So once the call is ended, all you have to do is bill the patient through super bill. So I'm just giving a random thing. Don't quote me on this. And then 974101.
So those are the codes that you normally put in.
Yeah,
right?
yeah. And then I put in 4 units. And then if I click send, Mike gets the super bill. So you'll get it on your email. And I will also get an email of the super bill that I sent to Mike.
That was fast. You're charging me already, huh?
So it has everything embedded. So this is where you would add your NPI number, your tax ID number, your email, so everything, and your license number, so the patient can verify you. So all the things that you need for compliance are already embedded in the system.
So I guess I paid before we started, right?
Yes, I charged you $0, so you didn't have to pay. But if I charge you $50 or $100, you pay me before you join the call.
Okay.
So you don't miss the call.
Pretty good. Pretty neat.
So so the goal was actually not to show the platform, but to explain to you about these things, right? So any questions here about the evaluation and how we do it?
I guess I'll have a lot of questions when it comes to evaluation, but yeah, just keep going because every patient is going to be different, right?
Yes,
So
every patient is going to be different, and you have to modify it to your patients.
so you really have to be creative, right? So
I don't stick to a standardized format. So sometimes the patient poses with unique challenges themselves, and then you have to change it and modify it as accordingly. So let's say we have a patient with balance problems. Okay. So I'm going to give you a case study. So let's say we have a 75-year-old male who had recurrent falls in the past 6 months. And the primary complaint he's telling you is that as he walks, he's swaying to the side and he cannot feel his feet well. So this is his chief complaint. He came to you with that. So what subjective measures would you give to this patient? What subjective outcome measures would you give this patient? Mike, where is our chat window?
It's right over there. Click the chat. Go scroll down, and you'll see the chat box.
Okay. Yes, yeah. Oh, we do have questions here. Okay. Are there any specific CPT codes to bill? Yes. I did mention this before in the billing section. These are the billing requirements. Can you see the screen right now?
Mm-hmm.
So these are our specific CPT codes for billing to telehealth service. So you would add these modifiers in essence. And when you come to insurance, certain insurances are allowing you to bill as is. Like if you were charging gait training or neuromuscular rehab or Therex or therapeutic activity, you'd bill it as is, the same CPT codes, but you only will add the modifier GT95 and the place of service code as 02. So those are the two additional things that you would add to your billing. Make sure you do not bill for massage and manual therapy. Sometimes people do that mistake. They also bill for massage and manual therapy, which you can do through telehealth. So just be careful to use those 4 codes and then bill the patient for those. And again, there are certain insurances which allow you, which ask you to modify the billing codes. So it always is better to call the insurance and ask them for those, seek those clarifications. And within the same insurance Cigna, they change it, like it's evolving, so they again change it. So what I've told today might not hold true 2 months down the lane or 1 month down the lane. It keeps evolving. So I had to change my prior presentation a lot because of all the new policies and updates. So this answers your billing question. Any other questions? Oh, yeah. So I asked a question, right? So if you have the patient with balance problems who is falling, who said he cannot feel the feet well, he's feeling numb and he has difficulty walking on uneven surface and is swaying to the one side, what subjective outcome measures could we give this patient to get some information ahead of time?
I would say the ABCDHI.
Yes, I think so. Yes. So with ABCDHI, within the ABC, it asks you for questions of, do you have difficulty walking on uneven surface? Or are you having difficulty walking in a poorly lit room? So that that makes us understand if the patient is visually reliant on his balance. And if the patient is having increased sway turning his head, that will be listed out in the DHI. So we can pick up if the patient has sensory organization difficulty or vestibular organization difficulty from these nuances of the subjective outcome measures. And when we come to the evaluation part of it, since he is a 74-year-old man, I would start with a wide base of support, feet apart, eyes open, eyes closed, and then I would carefully look at his posture to see if his calf muscles are stronger, how is his weight, is it shifted backwards or forwards, and also have him walk and observe his gait. And then if he has a caregiver, or if he's at a low fall risk, then I will have him walk with a walker or a cane, the timed up and go, and time him for it. And we can also document the gait evaluation or gait deviations in our Google's sheet, so that we can submit it to insurance, or we can have it for our own records. Yeah.
I have some questions too.
Sure.
I like really providing value every time I do a treatment. So I know we do this standardized test for us to record and see improvement. What other values do you provide to your clients? I mean, I know you do the treatment. That's a value that you do. Uh,
I spend
what
a
else
lot,
do
or
you
I spend a
provide?
lot of time on educating them. So
Mhm.
let's say if the patient has organization, like sensory organization difficulty, I help them understand why it's important. Like if the if they do not address the foot care, then they could end up with sores and then possible amputations and whatnot. And I also spend a lot of time on caregiver training. If you were to ask me to point out one thing, I think caregiver training
Mhm.
is what I really focus on.
That's
Because
true.
if we were training transfers or sit to stand, or even when you are evaluating balance, having the caregiver in the right position to guard the patient to avoid falls is hugely beneficial for the patient.
There you go. There you go. Those are the added value. Always remember, what is your unique selling proposition when you're providing telehealth services? Yes, we're therapists and everything like that, but how can you differentiate yourself from other therapists? So yes, you're going to provide obviously the standardized test. Yes, you're going to provide the treatment that is appropriate for that patient, and think more. So what else can you provide for this client, wherein you go above and beyond with this patient or with this client, and they will see like, oh gosh, this person is really providing excellent value. So when you're there already, I would recommend add some home modification. Home modification recommendation. Ask them, hey, how are you transferring well in your bathroom? How are you
Mhm.
getting out of your bed? How are you doing this? Stuff like that. And being creative. If you're an OT, obviously home modification, speech therapist, look at their sitting posture in their dining area, or whatever speech therapist does. And in my case, I come in and I do caregiver education, and I talk about dementia. That's my quote unquote selling proposition, a unique selling proposition. And I do that, and I would talk to them about dementia. So figure out what kind of extra service that you can provide. Asha, she's providing, the dizziness as a expert there, as a neuro expert. So what do you think you can provide extra on top of that? So I just wanted to reiterate that, providing that extra value, because like what I said, a lot of people are already going to do this. How can you differentiate yourself from other therapists? So,
That's great, Mike. Um, and then, like we can do the same timed up and go 5 times sit to stand is a huge indicator for overall muscle strength. I think in our previous demo, one person asked, how could you do manual muscle testing? Well, you can do it, but you could do a 5 times sit to stand, or a 30-second sit to stand, which is even better test of functional strength compared to, just manual muscle testing, quadriceps or hip extensors. So you're doing a functional testing, strength testing here. So that's it from a evaluation treatment perspective. Do you have any questions? And then we will go into marketing.
Asha, do you think we can eventually do a remember we talked about, the business to business platform that we're going to be
Mm-hmm.
offering. Do you
Mm-hmm.
think we can do an individualized evaluation per condition?
Yes,
You know,
yes, I think so. Yeah.
or in for example, because just to let you know, for those people who are watching and listening, we are going to, doing a business to business, and we're going to train people how to do an evaluation for every specific diseases. So, for example, stroke. How do you do that evaluation? How do you do a treatment for that? And it's going to be different every patient, but at least there's this standardized practice that we follow. In APTA, we can, I forgot what you call that, Asha. Standardized practice
Yeah,
that we.
it's yes, it's edge. Um, EDG, like neuro edge outcome measures. So
Yeah.
they,
Hmm.
yeah,
Yeah.
yeah.
So
So
we're gonna do that soon, and And then you can do that too. And you, for those people who are watching right now, whether on the live on replay, you can do that too, and be that specific go-to person, when it comes to that the specific disease. So, and then you could either partner up with us, me or Asha or whatever, and you can be that go-to person. So let's face it, when somebody asks about dementia, they're going to ask me, hey, Michael, how do you do this? So,
Right. Yeah. So, and we do have, experienced clinicians in our webinar. Like if you're experienced in pelvic health, you can come up with like, what unique subjective outcome measures can I give this patient to get the information? What
there you
unique
go.
objective measures can I collect, and how can I modify them? My head keeps spinning all the time. So when I'm thinking of stroke, there is this stroke rehab assessment measure. I'm thinking of, what if I actually provide the outcome measure in the platform, and I have the patient watch it and have them do it, and then time. All I have to do is time them. And it's easy for us to have the caregiver reciprocate the test, and it would be standardized. And the next stream of thought would be, how would you standardize this for telehealth practice? That could be a new thing that we can come up with. Because we do have standardized tests for in clinic. How do we have standardized? How can we standardize that for a telehealth practice?
Perfect. Yeah. I like what Kimberly reminded me. Evidence-based practice. There you go. You want the clinical practice guidelines. There you go.
Yeah.
Clinical practice guidelines. Using those, and then we can apply it to telehealth. And you, Kim, can be the speech expert. Whatever kind of speech standardized test you guys do. So yeah. All right, I'll stop talking.
Are there any questions? I don't see. I think I'm missing something here. Do you see any
really.
chat? Nothing? Anything in the chat window? Okay, cool. Yeah.
But because here's the thing, Kimberly, and people are still here in our webinar, it's evolving. Nobody has actually really owned telehealth except for Asha, who's been doing this for so long, or Rob Vining, who's doing it since 1920.
It's not 1920.
Nobody.
Yeah.
And nobody has actually implemented an evidence-based practice, clinical practice guideline on how to do a therapy evaluation on telehealth. And if we can pioneer, I cannot do it all. There's thousands of clinical practice guidelines that just for the physical therapy profession. If you're an OT, you can own that specific discipline and get a specific niche there. So same thing with Asha. She's a PT. Her specialty is just the evidence-based clinical practice guidelines for balance. That's it. Ask her about pediatric. I doubt she's going to answer that.
I won't answer.
So we're going to look for somebody who is actually a telehealth practitioner who knows how to evaluate a patient, a pediatric patient. Same thing with Kimberly. If you're a speech therapist, and then whatever your specialty, Kim, I mean, I don't know. I don't know.
I think she's pelvic floor. Yeah.
Pelvic floor or whatever, postpartum. You can do that. And you be the dysphagia. I don't know how you pronounce it. Dysphagia. You can be that evidence-based practitioner evaluation for dysphagia and aphasia. Boom. Of course, you ask Kimberly about pediatric SLP or whatever, I mean, she won't be able. So our goal here is to create that, the go-to person because I cannot do it all. Asha cannot do it all. And that's the ultimate goal. And then, of course, you developing and creating your own telehealth platform through Therex. In that way, you're earning money from seeing patient, and at the same time you're also earning money from being the voice and being the influencer in your specific niche. If that makes sense.
And it actually, if you think of it, you can reach out to, if you own one niche, you can expand to like all the 28 states that you can practice in, not just one state. And if you can do the digital marketing in the right way, build your SEO up, people will look you up, and when they look you up, they will want to obviously see the best therapist out there, not the generalist, but the specialist. That's what people benefit from, and that's what we could do with telehealth practice. It actually improves our standardization and our delivery of service at a higher quality.
There you go. There you go. I don't know if you guys know Tracy Sher. If you know Tracy Sher, she's a physical therapist, but she calls herself pelvic guru, and she goes around different states, different countries, and talk about pelvic stuff. And now, obviously, she is doing telehealth, online stuff, and it's a matter of owning that niche and just being that niche and just being that voice on that specific niche. So just like Kim, you can own that dysphagia or aphasia niche. So, all right, okay, I'll stop talking. I'll let you take over, Asha. If I don't stop, we're gonna be. Remember, I teach a 2-day class, so I can talk 2 days.
Yeah.
I'll stop talking. So.
Yeah. I also wanted, on a quick note, like 50 years ago, vestibular practice wasn't there. Someone started it, and then within 50 years, vestibular practice like evolved and then became so huge. So, like when we get to retirement age, maybe we'll be regarded as pioneers, who knows? So, without much ado, we'll then skip into digital marketing. Do you have any questions so far?
I don't see anything here.
Right.
Well, I see Kimberly asking, would love to learn more how to participate. You might want to join Kimberly, the master class that Emma leads, Emma Shapiro. She leads that class called the Alternative Healthcare Career Masterclass. It's basically being the voice for your own niche. So you can join that group, Alternative Healthcare Masterclass. So something like that. So, all right, I'll stop talking.
So we'll look at digital marketing. So I'm going to give you like the easy breakdown version of it. So the first thing is SEO, keyword search, which is search engine optimization or keyword search, and then website. So if you don't have a website, the first thing you want to do is build your own website, or you could look at freelancers on Fiverr, fiverr.com, where you could find cheap, not cheap, but relatively affordable freelancers, and use a WordPress site because it will help you with your SEO, or any site that has this SEO capability. And what you want to really portray is that the website is your marketing tool. So anything that you want to market, tell about yourself, your story, what you're really good at, the website should speak for it. And patients should be able to easily find you, know what you're doing on your website, and leave. I think Mike does a great job with it. He calls them click funnels. So what he does is you leave like a couple educational handouts on your website. So if you are a speech language pathologist, you are trained in sensory integration issues, then you would write an article on sensory integration issues and swallowing, or anything that you are recognized as an expert at. You'd write 2 or 3 articles and say, download this free resource by clicking here. And when you click there, you ask for the email, and then you can send these patients information. That patient has dysphagia. You can send them emails about dysphagia, and then short videos about what a successful practice is, or what the current clinical practice guidelines say, or what's the latest research available. So as the patient gets this value added information, even if he did not make an appointment at that point of time, he will make an appointment in future, or he will refer another patient or a known acquaintance that he knows to you. So in that, since cash-based practice, if you get one patient, you would earn like $2,000 to $3,000. So that's a lot of money if you think of how little you are spending on marketing with your website here. and provide free discovery visits. Right now, we are giving the platform for free. So if you can make a 15-minute slot and use $0 to it, you talk to the patient one-on-one, understand what their problem is, and then explain them what you would do within this 15 minutes. And then that patient converts it into a cash-based practice patient for you. So by just giving a 15-minute slot, if you allocate like an hour or 3 or 4 patients in a day, you will have more conversion rate through these 15-minute slots, because you will be able to create that one-on-one interaction with the patient. And like all the, I am not an expert in digital marketing, but this is what I learned from my personal experience. So when we post a message on Facebook or Twitter, we see how many likes we got, how many people engaged on it. Even if you have likes or you do not have likes, Google still counts the message that you have on Facebook or Twitter. So if I posted a message that is of value, like a knee replacement video or something on Twitter or Facebook, when I click my name and make sure it is linked with your practice, let's say your pelvic physio, you write hashtag pelvic physio, how to prevent incontinence or how to improve, how to be more continent. So that's your article. So it will tag that name to the article, even if that article does not have as many clicks. So keep writing, keep publishing on Facebook, and also blog posts. So I'm just going to show you how to do this keyword search through Google Keyword Search Planner. Most of these resources are free for us, and it requires a little bit of learning, but when we learn, we would do better than any outside freelancer because it's our area of expertise. So let me quickly show that to you.
Well, before you share that, Asha, I want to share my website too, and
Sure,
that way
but
people would.
let me
be able
stop
to
my
see it.
screen share,
Mhm.
or if you can activate your screen share.
How do I do that? Let me. Do you want to continue? Yes. Okay. All right. So let me know if you see my screen. So this is my website. Okay, drmikechua.com. It's not just telehealth. Okay, if you are seeing my website, comment yes in the chat box. There you go. Are you able to see my website, Asha?
Yes.
Okay, there you go. So drmikechua.com. So if I have a client, okay, so let's just say I'm here in the Alzheimer's and Dementia Support Group, right? So I'm here in the Alzheimer's and Dementia Support Group. I tell them, hey, if you need more information about dementia, go to my website, drmikechua.com. So they'll go to my drmikechua.com. I tell them, hey, you can download my book for free. Just put in your name and email. I collect their email and I spam them. Okay. I spam them with my dementia stuff. What do I spam them with? Okay. So let me just explain it to you. I spam them with, let me go all the way down. I spam them with all my articles, my video, my Facebook Live, my whatever, the interviews I do when it comes to dementia, or everything that I can share. So, well, where are the articles? So everything in the articles here. I'm gonna click the articles. So everything in the articles, my podcast, my show, and that's it. Everything there. I spam them there. And of course, if they don't want to, the information, that's okay. They can unsubscribe. So that's the reason why you have to have a website, because your website is going to be your sign, your signboard. What do you call that? Business sign, your billboard sign. So everything, I interview different people, from all different people. I just interview people. I go to conferences. Okay. So it's not an easy job, guys. You're not going to instantly, boom, get patients. It's actually a continuous process for you. So you need to go to different conferences and interview different people. I would set up a small space in the conference room or in different conferences, and I would interview different key opinion leaders there, and they enjoy it. All I have is my cell phone. That's it, right? And then from there, okay, I email them all these videos once a week or whatever. And if they are very interested and they want to connect with me, I tell them go to my store. Where's the store? Well, no, this is my podcast. They go to the services. Go to services, and they would just click here, PT dementia caregiver and patient consultation. They click there, and then all they have to do is pay $150, and then obviously add to cart, and then go through the process of checking out and paying, and then that's it. And then I send them a Zoom link, and then boom, it's online consultation already. It's not the physical therapy. It's basically caregiver education. All right, so you got to have a website. That's what Asha is talking about. So you need to have a website. If you need a website, somebody to create your website, you can talk to Emma about it. Emma Shapiro, our administrator in the Alternative Careers Group, or like what Asha said, you can go to Fiverr, you can go to Upwork and ask somebody to do it for you. But I wouldn't recommend that because some there will just do it for you for one time and then that's it. You need somebody that you have a relationship with, wherein if something happens, you can still continue doing it. So this website of mine is maintained by my personal VA. Her name is Natasha Rivera, and she's in the Philippines, and she has access to all of this, and she takes care of it. And I have a good relationship with her. So yeah. All right. Okay. I'll stop talking, Asha.
No, that's good. That's good. So I am just going to quickly show you how to do the ad search, because it will help you with your SEO. So here, what I'm going to do is to write Google.
Go ahead and share your screen again, Asha.
Oh, sorry.
Yeah.
So I've, can you see my screen?
Yep.
Okay. So all I'm typing in here is Google Keyword Planner. Okay. So, so this is this is from Google. This is,
That you vacuuming there, Asha?
I know, no, that's my computer. I think it's going to stop. That's what I am like worried about, but that's my computer. So
really?
yeah, so it's a gaming computer, and I think it's screaming. So sorry about that. But here.
So it has a very big fan, I guess.
It does, and there is a way to turn it off. So, but I don't know how right now. I have to dig deep into it. So what I went to here is ads.google.com. Okay. And you don't need to run any ad yet. Okay. But here you will see keyword planner in the planning. Okay. So let's say I'm going to create a blog post, right? So what I would do is, okay. So what I would do is I think I'm in the wrong thing. Keyword plan. One second. Let's try some other account. I think they just changed it from last week. That's why I'm struggling.
But for example, I don't have a website, Asha. Can I just use your platform?
Yes, you could. I'll just show this to you as to how I do it. So let's say we are so I'm going to show you a post that another therapist has written and how we made it SEO friendly. So this is a post that one of our subscriber, wrote about shoulder pain and mental illness. Okay, so if you look at this post, we know that depression and anxiety are keywords. Okay, because they had like maybe 1 million users researching them. So we want to repeat this mental illness in like all the titles. These are called H1, H2, H3 tags. Okay, so this is how Google reads any blog post. So based on this, if people are looking up for chronic pain and mental illness, your post will come up. So part of it depends on the content of it, but most of it depends on how you are wording it or how you are following the search engine optimization protocol. So if I look at this SEO, so if I do any error, it will tell me, like how I need to write and reword and rephrase this. So I need to add some outbound links, some internal links, and then the key phrase that I have selected, it has to be introduced and it has to be a certain length and density, and then it has to be listed in the meta description, which is underneath the image. You have to tell what that image is about, and the title need to be a certain characters. The text has to be sixth grade English, so all these things that you could do to mark yourself as a leader in your field. Like if people are looking for shoulder pain and chronic pain and anxiety, which is not unusual for people to have, then you would pop up. And then if you pop up on the Google SEO list, like on the top page, then people will see the value in you. And then what we do in our website is that at the end of each blog post, we ask them to, we direct them to our current users, so current therapists. So since the patient, as soon as he looks at the blog post, he finds you, he then is able to make an appointment with you directly through the telehealth platform. So I'll just show this in action. So if you are a patient, you click the patient blog, right? You entered this. So now at the end of this blog post, you will already see your name published here, and which makes you as a leader in it. But if I am looking for a telehealth provider, and I click search in the area that I am residing in, Okay. Then I would pop up. So then I could see myself and what I do. And then people can look you up and seek appointment from you because they will know where you are practicing. And, that's how you generate more referrals too. So what I would say is like, if I were to search Therex Portal in Google, so every time you write a blog post, you have to mention your website or the name of your business. So right now, this Facebook post that is at like number 2 is the featured therapist, Dr. Danielle Gordon. So she's the one who wrote the blog post. And if you're looking at this, all I did was like I published that blog post on Facebook, and look at this, it only had 2 likes and 1 share. But look at how it populated on the second field in the Google search engine. So the calculation or algorithm is very weird. So as long as the post has good content and good value, it gets featured on the top, even though it does not have a lot of likes. So the whole idea of like it has to have like 1,000 likes, only then it's good. That's not actually true for Google search engine. And most people, if they are looking up a health condition, they use Google as the primary source of information. People don't research on Facebook. They type on Google as to what their health condition is and how they want to find help from it. Does that make sense? Or did I complicate it? Yeah. Did it make sense? Yeah.
Yep.
Yeah. Okay. So I think, did you get a chance to share that links, Mike?
What link?
The link that I shared with all the documents.
Yeah, I posted it earlier.
Okay, sure.
I actually saved it on my OneDrive too.
Okay, perfect. Yeah. They have like useful links for quick reference if we were to research and get into telehealth practice in any new state that we want to practice in. Any other questions? So I think that's it for today.
Not right now. So for those who are in this webinar, Asha, how can we go in and get our Therex access?
Sure. So when you first, you can still see my screen, right?
Mm-hmm.
So what you would do, the first thing you would do is you click the register button. And here it says the access code is Therex Tele-Health, right? So you fill this form, type in your first name, last name, credentials, email ID, password, and then your phone number, and the countries, choose USA. And here in the access code, write Therex Tele-Health and complete this. So that will give you access to the home exercise program platform. If you also want to use the Tele-Rehab platform, it has a separate registration. We will mix both.
What's the difference?
So this gives you access to the video call that we did. That gives you access to the exercise program, the digital exercise platform. We plan to mix both of it to create a single sign-on. We are not there yet. We are working on it right now.
Okay. So
initially I developed the home exercise program and then I added the telehealth, but we didn't mix both of them together. We are currently working on it as we speak. But if you were to use telehealth on its own, you could use it. If you were to use the home exercise program on its own, you could use it. And you can screen share and share both with your patients. And the access code is the same for both home exercise program as well as telehealth. And when you use this access code, it will give you the free access for a month.
Okay.
And once you enter, so after you're registered, you would then go to the business associate agreement, which is the first step to make you HIPAA compliant. So Therex Portal signs a business associate agreement with you. So all your data security and policies are in place. And then you would establish your profile. So when you give the super bill, we have all this information populated from your NPI, tax ID number, and all that. And then as you establish the Stripe payment settings, you can charge and bill your patients directly. And this is our provider search where your patients can look you up based on your health condition or the nature of service that you provide. So let's say pelvic health. So we have 2 therapists who have registered to the pelvic health and their specializations and whatnot. One of them is from Seattle.
So even though we don't have a website, we can still do it there, right?
Yes. You can actually create your own updated profile here.
There's a question from Kimberly. Is this just for PTs? She's a speech.
You can use it. You can use it, Kimberly. And what I would suggest you do is, I am not a speech expert, so I didn't venture into it. But you would use the upload exercise feature here. And if you want to upload any information, you can upload a video. And when you upload a video, I'll choose a small video here. And when you, let's say, and when I upload a video, it takes screenshots of that video and sets them up as still images. So you can make this step 1, step
fancy.
2, and step 3.
What Kim can do is create her own video of herself and then upload it and then do a step-by-step. Yeah, I think that's great.
Yeah, and in that way you can have your own exercise platform, and all your exercises, Kimberly, will be listed in your My Therex folder. So if you create like 50 or 60 resources, they will live only under this, and it's easy for you to find it. And it only takes you a minute to upload. What I would suggest you do is to actually take videos, save them in your computer, and then you can spend like an hour to upload all of them, and you'll have your platform ready. So when you issue exercises through these, they're end-to-end encrypted. So you don't have to worry about any data encryption or anything. It's all HIPAA compliant. And when you're treating your patients, you're welcome to treat your patients and use the resources that we currently have. But I'm not sure if they would apply to you, so you can create your own resources. Did I answer your question?
Yep.
Okay. I keep asking that question because I tend to waver a lot. And then you can customize each instruction here. You can edit the parameters, you can change them, you can write new instructions, you can do whatever you want, and your patient will be able to see the video, see the still image, get a printout of it. And also if they perform the exercises, you can see the compliance to the exercise program. And this is how the patient looks like.
Kimberly is asking how much is the platform? It's very affordable, Kim, to tell the truth, for all this stuff and what's inside it, because I pay really expensive for Zoom. And how much is it, Asha? I know it's free right now, right? But
it's free right now, Kim. And when we don't plan to charge for the next 2 months. But when we roll out, we would keep it under $50. and you won't have any limitation of the hours, the number of patients you use. And if you are charging, I would recommend you charge at least like $120 to each patient. And when you charge them, you would get it like in half of the patient cost.
How about if you have an employee, Asha? How does that work?
Can you repeat like you're a clinic?
Yeah, if I have, for example, another PT that will
Work
work
for
for
you.
me.
Yes.
You do.
So right now the home exercise program platform has an ability to add your own users in the clinic. And the telehealth, we are currently adding more users to it, and also adding a scheduler as well. Because sometimes, the scheduler wants to check the BAA agreement or consent form, and you only want to treat. So we do not have the management portal in the telehealth platform, but it's going to be rolling out in the end of April, in 2 weeks.
Okay. So how much would it cost me if I add another therapist under me?
So maybe like $100, like together.
Mm-hmm.
So each user will be $50.
Okay. All right.
I think the HIPAA compliant version of Zoom is currently $200 per user, right?
Yep. Actually,
3 users?
$300.
$300. Okay. Yeah.
Yep. Mm-hmm.
So this is more customized to us. I don't intend to increase the price. I actually want to make it big in terms of telehealth, adding outcome measures, and keeping it unique to the rehabilitation stream.
Mm-hmm.
I think if we work together, we can create like a beautiful product.
Oh yeah. I mean, you already got it. I mean, majority of what you need is there.
Mm-hmm.
I mean, imagine what I have is just a Zoom, and I'm not even billing insurance, and it's
Mm-hmm.
just
Mm-hmm.
pure cash base. I don't
Yeah.
have all this fancy stuff. For $50, I think it's a good investment, and you've got all those bells and whistles there.
Mm-hmm.
Mm-hmm.
The users are very quiet now. I think they're tired.
Yeah. All right. Is that it, Asha?
Yes. So comment tired if you're tired. I would say tired. You don't ask that question, Mike?
No.
I think people get annoyed with our jokes.
Imagine I do 2 days of that, and it's different because you're running the game. I'm running. In my class, it's different because I asked them to speak.
I know that. Yeah, I know.
I asked them to speak. I asked them to do the lecturing.
Mm-hmm.
So I would tell them, "Hey, could you present this topic here?" And they'll be presenting. So, so
Yes,
it's they're talking most of the time, not me. So
that's good. That helps user engagement.
yeah. Mm-hmm.
Mm-hmm.
But again, thank you very much, Asha, for teaching us today. I appreciate you, and I've learned a lot again. And hopefully, we can dive more on that business platform that we're trying to do. And then also for those people who are watching on the live and the replay, thank you very much for watching. And if you have any questions, just shoot me a message or Asha, and we'll take care of that. And then, but before I let you go, are you done, Asha?
I am done. Do you want to leave my email to them?
Yeah, if you don't mind putting on the chat box.
Mm-hmm.
And they can
And
always reach out to me in Facebook or whatever, and then I'll forward them to you.
and I will add the slide site in the same link.
Mm-hmm. All right. So before I let you go, guys, always remember the word fast. FAST. I always preach this. Letter F. Find friends that will push you to your next level. You are the average of the 5 people you hang out with. If you want to be a telehealth practitioner, you have to find people who are actually doing it who are actually doing it. So find people that are actually going to push you to your next level. A lot of people will come out bigger and better in the situation that we have right now, but a lot of people are actually going to get worse because they are not adapting, they're not adjusting, they're not trying to be better themselves. And this is a great opportunity for us to start providing a service. Not all patients will benefit from telehealth, but some will do. Some will do it, and some are already doing it. I've been doing telehealth ever since I had the Teledoc. I don't know if you know Teledoc. That's where I have my online consultation with my physician. Simple cough and colds. I just press an app in my phone, and then boom, then they send a prescription to uh to Walmart. And if that's since 2015.
Yeah.
I've been using Teladoc software, and I changed insurance. Now I use MD Live. So much convenience. And for younger patients like us, younger patients, it's going to be appropriate. Obviously, for my population, it's a little bit tricky because I do Medicare, and not all of them have smartphones, so it's going to be tricky. But there are so much opportunities out there. So letter F, find friends that will push you to your next level. Next letter is letter A. You gotta take action, guys. You've invested in a course. You've invested time watching and listening to this video, webinar with Asha. You gotta take action, guys. It doesn't have to be big action. If you don't know how to create your own website, get the Therex Portal. Go inside there and register. That's as simple as that. It's not complicated. If you are able to sign in to this complicated Zoom webinar, you can probably going to be able to register in the clinician registration. It's very simple and it's very straightforward. Okay, what's the next letter? Letter S. You got to learn how to shoot for the moon. Keep shooting for the moon. Why? Because if you're going to miss it, you're going to be eventually landing with the stars. You're going to miss it. You're going to fail. I'm telling you now, it's not going to be perfect. We're all adjusting to the situation right now. We're going to fail, guys. You're going to be rejected. You're going to have that, what you call imposter mentality. You'll be like, should I really do this? I don't know what I'm doing. Guess what? Up until now, I don't know what I'm doing. I don't know what I'm doing right now. But does that stop me from getting better and start, doing all this stuff? No, because people, your patients, your clients needs you. You're a therapist. If you're watching right now, you're a physical, PT, OT, speech, whatever kind of therapist you are right now watching and listening, they need you out there. Don't be selfish. Don't keep that information to yourself. Go out there and share your story and educate them and bring the best out of them. All right. And last but not the least, letter T, teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And that's the reason why you need to do telehealth, because you're teaching the clients and you're understanding it more, and you'll be the thought leader in that field. All right. Again, thank you very much. Asha, any last parting words for us?
That would be it from my end. I also wanted to let you know that I heard this earlier. The government is going to issue a huge grant for telehealth. So what it does is the grant is going to be used to purchase iPads for patients to use telehealth services for rehabilitation providers. So improving internet access and also giving them iPads and tablets to utilize telehealth services. So
it's amazing. It's amazing.
So I think we are going to it's going to stay here. That's my gut feeling. It's not going anywhere. I think people will see the value in it, and then more insurances will accept it, and it's another stream of revenue for us.
Yeah, and then I remember, there's this. You can go ahead and stop your screen share, Asha.
Oh, how do I? Oh, can you do it from your end?
No, let me do it. Let me try. There you go.
Perfect. Thank you. Thank you.
Perfect. And also, one added value service that you can provide is you actually provide an iPad for your patient. It doesn't have to be a nice iPad or nice tablet. I know you can have a rental. You can have rental equipment. Let me show it to you. this company here has actually reached out to me, and they gave me a free tablet for their services. It's called Remnix, and they give me this. It's free, but every time the patient, it's for dementia. Okay, it's for dementia. Every time the dementia patient looks at it, it shows up certain memories for that specific patient, and the family can connect through that app. So it's automatic. It's automatic when the patient removes it on the charger, it will play their music if the battery's dead. But it will play the music, the pictures that the family can upload here, some memories, whatever, music or whatever kind of memories, picture and everything. And then the family can connect. And it's a membership thing. I think it's $50 a month also. And it includes the tablet already. Imagine that.
That's awesome.
So you can probably do that to your clients. For example, we will do a weekly or whatever, 3 times a week, twice a week. Imagine if you're charging $100, $150 per session, you can provide that patient a tablet like this and then give it to them or do a rental or part of the program. You can mail it to them or whatever with your app or something. I don't know. I don't know how they do it, but if they're making money out of it, $50 a month, if we're a therapist, I think we can do it too. These are not therapists. They reached out to me because they thought, right, I'm a dementia expert. So, hey, Michael, can you trial our stuff? A lot of companies, they reach out to me and they say, well, send me some stuff to promote in our group. So if they can do it, we can do it too as actual thought leaders in our field. All right, I'll stop talking. Thank you very much, Asha. I appreciate you. I wish you all the best, and I will see you when I see you guys.
Thank you, Mike.
Thank you, Asha. Bye-bye. Thank you, everyone.